Buenos días a todos y welcome to PAHO and the one who traveled to Washington, D.C. My name is Nicolás Lago Marcin.
My name is Nicolás.
The responsible of the governing bodies here. So the GBO, the governing bodies team, and myself, we are available for anything you need. We'll start the meeting just before giving the floor to Dr. Barbosa. We have interpretation in the three languages of the subcommittee. Those are English, Spanish, and Portuguese, and we try to set the receivers in your mother tongue, but if not, you can let us know and we will help you change the language. So, Dr. Barbosa, the floor is yours.
Thank you, Nicolás. Good morning. I would like to extend a warm welcome to the members of the subcommittee and all other member states participating as observers to the 20th session of the Subcommittee on Program, Budget and Administration, our SPBA. I'm pleased to inform you that the delegates of Argentina, Brazil, Canada, Ecuador, Grenada, Guyana, and Panama are present. With the 7 members of the subcommittee in attendance, there is quorum. I therefore declare the session of the subcommittee officially open. I will now proceed with my opening remarks. Distinguished delegates, welcome to the Pan American Health Organization. It's my pleasure to declare open the 20th session of the Subcommittee on Program, Budget and Administration. Before we begin, I would like to assure member states that PAHO continues to support technical cooperation in an evolving global landscape. While we have maintained cost-containment measures, we remain firmly committed to our core mission. Over the past biennium, PAHO has operated in a complex and demanding environment. Resource constraints and uncertainty have required constant vigilance, rapid adjustments, and difficult decisions, including measures affecting personnel and teams. As we move forward, we must continue to address these challenges with transparency, respect, and solidarity. Thanks to prudent management, we have mitigated the funding gaps and achieved a high level of implementation of the 2024-2025 program budget. Our impact, however, continues to depend on collective action and on maintaining member states' trust in PAHO as a strong and reliable partner. Allow me to highlight a few key technical achievements from the past year. Through the Disease Elimination Initiative, countries in the Americas are accelerating progress toward eliminating more than 30 communicable diseases by 2030. Significant milestones include Suriname becoming the first Amazonian country certified malaria-free, Brazil eliminating mother-to-child transmission of HIV, and Chile becoming the first country in the region to eliminate leprosy. At the same time, the resurgence of measles reminds us that these gains are fragile and underscore the need to restore vaccination coverage, strengthen surveillance, and ensure rapid outbreak response. PAHO has also advanced the efforts on non-communicable diseases through the Better Care for NCDs initiative. Under HEARTS in the Americas, 11 countries and territories now implement the clinical pathway in over 80% of primary care facilities, reaching 6.3 million people and achieving hypertension control rates above 58%. This is a remarkable achievement when we compare that in average, the hypertension control rate is around 30% only. In parallel, diabetes care pathways have been introduced in 16 countries. Access to diagnostic tools has expanded through the strategic fund. Cervical cancer prevention has been strengthened, and more than 500,000 health professionals have completed the training through the PAHO Virtual Campus for Public Health on non-communicable diseases care. The Alliance for Primary Health Care in the Americas, launched in December 23 by PAHO, the Inter-American Development Bank, and the World Bank, has established itself as a regional mechanism to accelerate PHC implementation through coordinated policy dialogue, investment planning, and strategic innovation. To date, 9 countries have established formal collaboration mechanisms. The last one was Argentina, last week or 2 weeks ago when I visited the country. This alliance is helping to guide investment, incorporate new technologies, and accelerate the transformation of health systems. combined concessional financing in participating countries exceeds $1 billion. By strengthening the leadership of Ministers of Health and leveraging these resources, we are improving the efficiency and effectiveness of primary health care. This week, we will welcome Guatemala as the 10th participating country, and we hope that others will join soon. We also advanced the integration of determinants of health into health systems through reforms, policies, and planning frameworks at the national level. This approach is making it possible to strengthen primary health care from a more comprehensive perspective. For example, in Costa Rica, the Strategy for Optimization of Face-Level Care Services 26-2031 incorporates these determinants as the central axis of strengthening primary health care. In Chile, its inclusion in the reform for the universalization of primary health care is guiding the redesign of priority programs and health planning processes for the period 27-2030. The digital transformation of the health sector has established itself as a strategic priority to build more efficient, resilient, and people-centered systems. Countries are making progress in strengthening data governance, interoperability, and adopting international standards. We also made progress in the implementation of the Pan-American Digital Health Highway and the use of data science, geospatial information, and advanced analytics for timely and evidence-based decision-making. In parallel, cooperation in artificial intelligence is intensified, driven by a growing demand from member states, with an emphasis on governance, safe adoption, and its application in public health, always ensuring ethical use, human supervision, and the generation of trust. PAHO continues to expand the equitable access to vaccines, medicines, and health technologies, from insulins to innovative products and biosimilars, while strengthening regional innovation and production capacities. Of note are the advances in mRNA vaccine platforms in Argentina and Brazil. In Argentina, Synergion Biotech has initiated the development of an mRNA vaccine candidate against pandemic H5 influenza, demonstrating the regional potential to contribute to global health security, while strengthening sustainable and accessible technological capacities for the future. In 2025, the regional revolving funds made 2,500 shipments of vaccines, medicines, and other technologies from 160 suppliers, with a growing participation of regional manufacturers. The revolving fund for vaccines consolidated agreements with producers in the region to cover approximately 25% of regional demand, compared to just 1.5% in 2020. This progress reflects the strengthening of regional capacities and great autonomy in access to strategic inputs. Likewise, in medicine, including oncology and antiretroviral drugs, price reductions of between 40% and 90% have been achieved, which allows expanding access, advancing public health goals, and contributing to the sustainability of health systems. These advances are complemented by innovative supply agreements that have significantly improved the delivery times. As a result, seasonal influenza vaccines began arriving in countries from the end of January this year compared to March in previous years, marking tangible progress in response capacity and impact for our member states. Let me now switch to
the program budget 2026-2027 that was approved in our directing council last year presents a reduction of 38 million compared to the 2024-2025 biennium, going from 700 million to 662 million. This reduction was a response to a host of factors, among which the increase in the number of countries that have not made their contributions and the reduction of recourses called for from or that were foreseen to come from WHO. As a result, the organization has continued to undertake a number of measures, among which stand out continuity and application of expenditure contention measures, including a reduction of meetings and trips, as well as prioritizing strict hirings only. These actions have given rise to savings reaching nearly $23 million for the 2024-2025 biennium. Strengthening advocacy vis-à-vis member states to promote the timely payment of their assessed contributions, broadening efforts of resource mobilization. Currently, the estimated financing to start the 2026-2027 biennium reaches 75% of the approved budget for the base programs, that is $495 million of a total of $662 million, which represents a deficit of 25%, amounting to $167 million. Within this context, the flexible funds become especially critical for the implementation of the approved base program. The organization depends in large measure on states actually making their payments on time for us to meet the priorities established by the member states and to achieve the results we seek. It bears mentioning that flexible funds include $142.7 million from WHO that have already been pledged, thanks to the advocacy effort put forth by member states. Likewise, it's important to stress that the assessed contributions of PAHO have not been increased over the last 13 years. What that means is that there's actually a $70 million drop if we factor in inflation over the time, which represents it shows the effort that this organization has made to make our organization more efficient, even within the context of a cutback of available funds. Finally, new mechanisms have been established for member states to contribute to closing the financing gap without taking on any long-term commitments, such as the basic voluntary contribution, which is a new modality of national voluntary contributions. That can be a partner, a donor, contributor. And that means that can be used to close the gap for basic programs, as well as national voluntary contributions, which are resources that countries can offer to more swiftly implement, undertaking further actions to carry out the cooperative efforts in every one of the countries of the region. On the agenda of this week, there are going to be some aspects of importance, including the presentation of the financial report 2025, which reflects a sound position with the revenues of $1.4 billion in expenditures of revenue and $1.36 billion in expenditures. All these acquisitions on behalf of the member states, such as the voluntary contributions that grew during 2025. However, the level of assessed contributions remaining amount to $50.6 million in 2024, now $113 million in 2025. I would call upon member states to make their contributions on a timely basis, because that's the only way that we can ensure the implementation of the biennial program that was approved by the member states last year. In human resources, at this meeting we'll be presenting the strategy, People Strategy 3.0, which guides the management of talent for the next 5 years with a stress on leadership, competencies, and accountability in order to ensure competent labor force that is empowered and committed. As you will also learn about the learning platform for a respectful workplace, stressing shared values and mutual respect among staff. Likewise, we will share with you the PAHO Forward 3.0 progress made that's focused on modernization, innovation, and simplification, including presenting headway made in the implementation of the Shared Services Initiative to enhance efficiency, efficacy in administration. To conclude, I would like to reassert that the true value of PAHO is in regional solidarity, as well as our ability to act together. In closing the biennium 2024-2025 and the strategic plan 2020-2025, I would like to thank the member states for their commitment and the trust they've deposited in me, all of which have made it possible for us to achieve these measurable and concrete goals. As we look forward to the new strategic plan, we'll have the opportunity to transform health systems, to spur innovation, and to ensure sustainable impact. Our experience and cooperation working together is our best asset in order to achieve these goals. I offer a warm welcome to the 20th session of the SPBA, and I thank you very much for your participation, commitment, and leadership. PAHO will continue being a trustworthy partner to ensure that collective action will continue to produce tangible and transforming results. Thank you very much to all.
I would like now to yield the floor to Mrs. Mary Lou Valdez, Deputy Director of the Pan-American Sanitary Bureau, who in her role as Secretary of the 20th session of the SPBA will make some announcements.
Good morning, everyone, and thank you. Thank you, Director. In accordance with the rules of procedure of the subcommittee, the working languages shall be those of the members of the subcommittee. Therefore, interpretation is being provided in English, Portuguese, and Spanish. Delegates are kindly asked to give their name and country each time they take the floor. This will facilitate the official record keeping of the interventions. Members of the subcommittee will be recognized before other member states that are participating as observers. As usual, all members are asked to limit their interventions to 3 minutes. A time tracking system will be displayed on the screen to help delegates to keep track of time during the interventions. Instructions for the use of the microphone are as follows. To request the floor, please press the silver button that's on the middle of your microphone base. The green light request will light up that your request has been registered. Please note that pushing the silver button a second time will result in your request being deleted from the queue, and your place on the speaker list will be lost. So please hit it once and then hold tight. To speak, the President will recognize your request, and then the red light will light up to indicate that your microphone has been activated. Your microphone will be live as long as the ring on the microphone is red. When you finish speaking, please press the silver button again to disconnect the microphone. We would like to remind the delegates to please send your interventions to interventions@paho.org. This will help with the preparation of the final report of the session. Please ensure that each intervention includes the name of your country and the agenda item, all written in full. Access to documents, daily programs, and updates during the session of the subcommittee is available on the PAHO webpage and through the PAHO Governing Bodies app. You can download the app to your laptop or smartphone, and we encourage you to use it. Each delegation has also been provided an iPad at your desk. The documents and presentation for this session of the subcommittee have been uploaded onto the iPads. Any updates will be uploaded directly onto these. On Thursday morning, March 19th, the subcommittee will discuss item 3.3, non-state actors and official relations with PAHO. And today, a commemorative photo of the heads of delegation will be taken right after the morning session for lunch, before the lunch in breaks for lunch in room A, so that the photograph is in room A. At 4:30 today, a brief session on PAHO Forward will take place here in this room. And also today, following the closing of the afternoon meeting, there will be a welcome gathering for participants of the subcommittee. And this will take place in the Delegates Lounge, which is on this floor just around the bend. Please note that this room has 2 exit doors at the back. And in case of an emergency, please proceed to evacuate through these doors and follow the instructions given by the floor wardens wearing an orange vest. Thank you, Mr. Director.
Thank you, Madam Deputy Director. I would like to bring item 2.1, election of officers, to the attention of the subcommittee. In accordance with Rule 5.2 of the Rules of Procedures of the Subcommittee on Program, Budget and Administration, the subcommittee shall choose from among its members a president, a vice president, and a rapporteur, who shall serve until their successors are elected. I therefore invite the nominations for the position of President of the 20th session of the Subcommittee on Program, Budget and Administration. Yes, I recognize Canada, and please, Canada, you have the floor.
Good morning, esteemed colleagues. Canada would like to propose Grenada to serve as president. Thank you.
Thank you, Canada. Are you in agreement with the proposal from Canada? I see no objections, so I see no objections, so Grenada is elected by acclamation. I invite the Honorable Philippe Telesfor, Minister of Health of Grenada, to take a seat at the head table and assume his role as President of the Subcommittee.
Thank you, Mr. President, members of this subcommittee. Good morning, and thank you so much for the confidence in Grenada to chair this session of the 20th Subcommittee on Program Budget and Administration. Before I begin, I wish to offer a few comments. Distinguished colleagues, ladies and gentlemen, good morning and welcome to this important meeting of the 20th session of the Subcommittee on Program Budget and Administration of the Executive Committee, where great minds and dedicated leaders unite to share perspectives, strengthen collaboration, and ensure that our resources are planned and allocated with wisdom, purpose, and purpose for stronger health systems in our regions. It is my privilege to chair today's session and to extend warm greetings to our representatives from the Pan American Health Organizations, Panama, Ecuador, Canada, United States of America, El Salvador, the Caribbean, and across Central and South America. Ladies and gentlemen, proper and realistic planning and the careful use of resources are not just deliverables, they are essential in times like these. Colleagues, we know all too well that currently we are operating in a world marked by rising oil, food, and medicine prices, economic turbulence, protest actions, and conflicts that contribute to reshaping the global geopolitical environment. However, against this backdrop, our responsibility is to ensure that every allocation we make reflects prudence, foresight, and fairness. Budgets are more than financial documents. They're instruments of trust, sustainability, and impact. They determine whether our health systems can withstand the shocks, respond to emerging needs, and deliver care where it matters most. As chairman of this meeting, I encourage each of us to deliberate with clarity, transparency, and collaboration, keeping in mind that every resource we allocate represents lives touched and communities saved. Together, we can strengthen our collaborative resilience and ensure that our planning reflects both the challenges of today and the opportunities of tomorrow. Thank you, and I wish you all a very enjoyable meeting. I would now like to continue with the election of the Vice President and Rapporteur. I would like to propose Panama for the position of Vice President. Are we in agreement? I see that there are no objections, so I take it that we all agree Panama is now duly elected as Vice President. I would like to propose Brazil to serve as rapporteur. Are we in agreement? I see positive nods, so it means that we are all in agreement. So I thank you and I congratulate Brazil as a rapporteur. I invite Mr. Ciro Leal Martins, de Cunha, Minister Consular, alternate representative of Brazil to the Organization of American States, to take his seat at the head table and assumes his role as rapporteur of the subcommittee. Okay, I refer you now to item 2.2. That's the adoption of the agenda. I would like to bring item SPBA 21, REV 3 provisional agenda, and SPBA 20 WP preliminary program of meetings to the attention of the subcommittee. I would now call on our secretary to report on the subcommittee on the statutory provisions concerning this particular item. Thank you.
Thank you, Mr. President. Rule 4, Paragraph 4 of the Rules of Procedure for the subcommittee reads, "The subcommittee shall adopt its own agenda, and in doing so, may make such additions or modifications to the provisional agenda as it may wish, except to those items that are placed on it by the conference directing council or the executive committee. Regarding the preliminary program of meetings, please note that the meeting of the working group on the item appointment of one member to the audit committee of PAHO will take place today at the lunchtime." Thank you, Mr. President.
Thank you, Madam Secretary. I will now open the floor to the plenary for comments. If there are no comments on the agenda, I now declare that the agenda and the program of the meeting is adopted. I now proceed to the next item on our agenda, item number 3.4, appointment of one member to the Audit Committee of the Pan American Health Organization. I will now bring document SPBA 25 to the attention of the subcommittee and invite Dr. Miguel Vernier, legal counsel of the Pan American Sanitary Bureau, to come to the head table and present this item.
Gracias, señor presidente.
Thank you, Mr. President, distinguished members of the subcommittee, director, colleagues. It is a great pleasure for me to introduce the document appointment of one member to the Audit Committee of PAHO. The Audit Committee of PAHO was established in 2009 by the Directing Council to function in keeping with the terms of reference adopted by means of Resolution CD 49.R2. In keeping with aforementioned terms of reference, the Audit Committee provides services to the Director of the Bureau and member states through the Executive Committee. The Audit Committee is an independent advisory body on the operation of the financial controls of the organization, the structures for the submission of reports, risk and management processes, and other controls related to the audit. The committee is made up by 3 members appointed by the Executive Committee. The members can perform up to 2 full 3-year mandates. The members of the Audit Committee ought to abide by the highest level of integrity and to be fully independent from PAHO. The selection criteria set forth in the terms of reference call for recent experience in the candidates and relevant experience at a higher level in finance, audit, and other areas related to oversight. In keeping with the terms of reference, 3 members of the Audit Committee have been elected by the Executive Committee. In 2023, Mrs. Sarah Greenblatt was elected up to June this year. In 2024, Mrs. Elizabeth Folsom was elected up to June 2027, and in 2025, Mrs. Maria Rios was elected up to June 2028. In view of the termination of the mandate of Mrs. Sarah Greenblatt, the Director has prepared an abbreviated list of candidates in order to cover the vacancy of the Audit Committee to be submitted to the consideration of this subcommittee in formulating their recommendation to the SPBA, to the Executive Committee, where the election will take place. The Secretariat has distributed in a confidential envelope the relevant backup documentation regarding the 4 candidates of the subcommittee. We invite the subcommittee to take note of this report and to consider the establishment of a working group in order to review the abbreviated list of candidates submitted by the Director for their election to the Audit Committee of PAHO in the upcoming session of the Executive Committee to be held in June this year. Mr. President, with this I conclude my presentation, and I will gladly respond to any query you might have. Thank you very much.
All right, thank you very much, Dr. Bernal. Now, to facilitate the discussion on this item, a working group comprised of 3 members of the subcommittee will be established. The working group will meet in private with the support of legal counsel to study the information on the proposed candidates for the Audit Committee of PAHO, and subsequently, the chair of the working committee will report on the deliberations of the subcommittee. The background information for each of the candidates was shared with members of the subcommittee. So I would like to designate the following: Argentina, Brazil, and Canada as members of the working group. I asked the delegates of Argentina, Brazil, and Canada whether they would have any objections at all to the designation. Do we have agreement from you? We do. I now would like to ask delegates whether you have any objections. And you don't. Very well, thank you. I would like to inform that the working group will convene immediately at the end of the morning session in room 414, following the official photo. This item will be visited in a subsequent session. Okay, so before we move on to the next item, I would want to invite us to take a quick break. All right, sorry. I hope you enjoyed that one. That was an advertisement for the break to come. All right. So I wish to move on to the next item, item 4.2, which is the overview of the financial report of the director for the year 2025. I would like to therefore bring your attention to SPBA 27, to the attention of the subcommittee, and invite Mr. Christos Casapanto, Director of the Department of Financial Resource Management of the Pan American Sanitary Bureau, to come to the head table to present this item. Dr. Casapanto.
Thank you, Mr. President. Mr. President, Director, members of the SPBA, allow me to present an overview of the financial report of the Director for 2025. The accounts of PAHO are presented according to the International Public Sector Accounting Standards, IPSAS, as they are approved by the governing bodies. This is preliminary unaudited information for 2025. The external audit is in progress, and the final results will be presented to the Executive Committee in June. I'll start by presenting a highlight of the total revenue of the organization as evolved over the years. You see we have from 2019 to 2025, we have the peak during the pandemic, which was really exceptional. We see the trough in 2023, and then in 2025, the revenue of the organization is $1.4 billion US, compared to $1.3 billion in 2024. This represents an increase of approximately 7.5%, continuing the recovery observed after the decline in revenue following the exceptional levels recorded during the pandemic years. The main source of the revenue were the green bar that you see here, 64%, which is $915 million from procurement of public health supplies. The $214 million, 15% from voluntary contributions. The blue bar to the right, $104 million, which is 7% from assessed contributions. 7% was from WHO allocations, which is the $97 million. And finally, about $69 million from other sources. Mainly, this is investment income and other miscellaneous revenue, among which is the net surplus from the sale of the Virginia Avenue building. As in the previous years, procurement activity remains a larger driver for the revenue, and we're going to discuss to give some highlights for each of these categories. Now, regarding the assessed contributions, the assessed contributions from the member states are due 1st of January each year, and under the international accounting standards, they are recognized as revenue regardless of whether they have been received or not. In 2025, the collections remain below the level of the assessments. As you can see, we collected 41 million, of which 34.4, the light blue part of the bar, it's from current year payments, and the remaining 7 was from previous year. What is the result? The result is that we have an unpaid balance of 113.5 at the end of 2025, up from the 50.6 that you see at the end of 2024. So we have significant increase and unprecedented increase of the unpaid balance. The question was how PAHO managed to work and deliver on the program budget. This was managed through full utilization of the working capital fund and relied on internal borrowing. And that's how the program was managed to be delivered for this biennium. Now, sorry, going back. What I would like to highlight, though, I would like to highlight and thank 3 member states for paying their dues of 2026, Brazil, Canada, and Peru. So far, we collected 28 million. And we have an outstanding balance because, as you know, from 113, we recognize the full dues in the beginning of January. We are at 190 million due at this point. So I urge the member states to proceed with the payments of their dues in order for the organization to manage to implement the program budget. Approved. And at this point, we're reviewing here the revenue from procurement on behalf of member states. We see that from the 12th after the pandemic in 2023, we have a significant increase. We are at 915 million. This is a 12% increase from 2024. And you see, of course, the revolving funds for access to vaccines at 700, the blue bar, 753 million, and significant increase as well of the revolving funds for strategic public health supplies. In 23, we're saying that the revolving funds, the procurement funds are going to overshoot the pre-pandemic level, and this is what is happening right now, and you can see it in the numbers. Next slide. Here we see the voluntary contributions. We are at 214 million in 2025 from 200 in 2024. And this is a 7% increase. It's a combination of significant increase of national voluntary contributions. You see the green bar, 132 million from 99 the previous year. We have the voluntary contribution for emergencies, the red bar, 23 million from 26 at 2024, and the voluntary contributions at 59 down from 75. Now, of course, the organizations try to use different methods, more, including, for example, we introduced in 2025 the core voluntary contributions, which are unrestricted contributions. We've had a contribution from 500,000 from Spain for that. It was recorded in the year, and this is expected to increase in 2026. Now, looking at the expenses, of course, the expenses, they follow the revenue, but also on this particular slide, the green bar, which is the supplies, distorts a bit the situation of the expenses. So we prefer to show what are the expenses if we remove the supplies. And then we can see that there has been effort due to the financial situation of the organization to reduce the costs. And, but some of the costs have increased simply because we increased the implementation of the national voluntary contributions. And starting, for example, from the staff cost, the staff cost 2025 was at 153 from 149. And this was due to an additional increase in the primarily to the G staff of 3.5 million that was put as a provision for 2025. Then we see the contractual services, which is the red line there, the purple line there, which is mainly due to higher costs for meeting facilities, professional services from national voluntary contributions, primarily from Brazil. And you will notice, for example, the travel, which is the red bar in the middle, reduced from 41 to 37 million. Now, travel, this is comprised of travel of PAHO staff, which was 11.7 million. It reduced from the 17.5 million, so significant decrease. And the increase comes from additional travel from member states who travel to attend meetings and training. So, and the net effect, of course, is the reduction primarily due to travel of the lower travel from the PAHO staff. We present the after-service health insurance, which is the PAHO's liability, significant liability in the books. The staff health insurance fund covers active and retired staff, and liabilities are based on the actuarial projections. The total after-service health insurance obligation approached 301 million, as you see at the last bar, compared to 244. Every 3 years, we do a proper actuarial study rather than a rollover. And the primary reason for the increase of the liability is the actuarial assumptions. But what is important to note is that the funded component, which is the gray part of the bar, increased from 102 to 125 million. This increase from investment income from the investment of the assets primarily, and also from containment of costs and additional contributions to the organization. So the objective is to increase the funded part of the assets gradually, and you can see the trend over the years. Now, here, the summary for 2025, as we said, the audit is in progress. The auditors from Chile are already here, and they are going to complete it just before the audit committee in a few weeks. The consolidated revenue of the organization at 1.4 billion for 2025 is 7.5% higher than 2024. A paid balance of assessed contributions at the end of the year was 113.5, which is significant again. I petition to the member states to proceed with the payments of their dues. Procurement on behalf of member states at 915 million from 814. Voluntary contributions, 7% increase at 214 from 200, in 2024. And expenses during 2025 were 1.4 billion versus 1.2. Thank you very much. I'm open to your questions if you have any.
Thank you, Dr. Casapontoni. I think I'm getting closer with the name. All right. The subcommittee is invited now to take note of the document and provide any comments that it deems necessary at this time. I will now open the floor for comments from the committee.
Request again. Request. Can you request again, please? Thank you.
Right. I recognize Brazil.
Obrigada, senhor presidente.
Thank you, Mr. President. Brazil expresses its gratitude for this overview of the financial report for 2025 and take note of the information submitted. We acknowledge the effort made by the Secretariat in maintaining the high levels of transparency and accountability in the financial report of the situation. The preliminary report shows an increase in the consolidated balance of the organization with increase in the total expenditures, reflecting continuity of programmatic activities of the organization. At the same time, we observe with concern the situation of fixed contributions. In keeping with the document and the presentation, some member states have not paid their dues completely. We still see a significant number of contributions that are pending to be settled. Brazil believes that the timely payment of dues is essential in order to ensure financial stability of PAHO, thus making sure that the organization will fully carry out its accepted and approved programs. In this context, we would like to say that Brazil has already made the payment of its dues for 2025 and 2026, reaffirming our commitment with the strengthening of the organization and with the regional cooperation on health. We thus urge all member states that have still not made their payment of the dues to do so as soon as possible to support the financial sustainability of the organization and ensure continuity of the activities that benefit the whole region of the Americas. Thank you.
Thank you, Brazil, for that intervention. And indeed, the payment of dues is critical to keep the organization moving forward and for us to achieve all of our objectives. So thank you again. The floor recognizes Peru.
Señor Presidente.
Mr. President, thank you very much. Please allow me at the outset to express our recognition on behalf of Peru for having been elected to preside over this session of the Subcommittee on Program Budget and Administration. We're grateful for this forum in order to reflect the administrative and financial aspects of the organization with the transparency and control which are essential in order to ensure its good operation and sustainability. In connection with the issues under item 4 of the agenda, particularly the overview of the financial report for 2025, my delegation would like to reiterate the importance of maintaining a sound, foreseeable financial consolidation aligned with the priorities of the organization. That is essential in order to beef up the response capacity of PAHO to the challenges in the region. In this context, Peru wishes to reaffirm its commitment with the organization and with compliance with its duties as a member state. I'd like to say that my country recently covered the payment of its corresponding dues as a clear manifestation of that commitment and our willingness to cooperate to the adequate operation of PAHO. Last but not least, we reiterate our willingness to continue participating in the deliberations of the subcommittee, thus contributing to institutional strengthening of the organization and the attainment of its goals on public health. Thank you.
Thank you, Peru, for underscoring your commitment to the organization and for paying your dues as Brazil has. And it is indeed important for us to embrace sound financial principles as intimated. Thank you. If there are any other contributions, the floor is still open. Okay, since there are no other contributions or interventions, I now invite Mr. Casapantuni to offer his final comments and responses.
Mr. President, thank you. I would like to thank the delegation of Brazil and Peru for their, again, for the intervention concerning and also the payment of the dues on time of 25 in 2026 and the support of the technical cooperation and the program budget of PAHO. Thank you.
Thank you so much, Director, for your comments. Dr. Barbosa, do you have any comments that you wish to add?
Thank you. A very brief one, Mr. President. First, I want to thank member states, as Mr. Casapantonio informed, the final report will be presented to the Executive Committee, so these are partial figures that we have, but I think that the trend is already there. I think that is important to highlight that the figures are showing and here reassuring our member states that we are making a very prudent financial management of this organization, looking for efficiency, looking for all initiatives that can be implemented to reduce the cost of operation of this organization in order to keep providing technical cooperation, even in the scenario that we have nowadays of some financial uncertainty and the reduction of the budget that was approved by our member states last year. And finally, I also want to thank Brazil, Peru, and all the member states like Canada that have already made their payment for this year. And also to recognize and to thank Spain, that was the first donor partner country to make a contribution to the new model that we have, the core voluntary contribution. So I think that this, you can see also relate to the figures, the efforts that we have made to having more partners and donors contributing to the organization, because combined with the assets contribution, these are the main sources that we have to finance the organization. And also to call your attention about some expenses that we have, that we kept all of them in a stable position when we look for the previous year before the pandemic, but even with a reduction. Because we are providing a better use of the technologies that are available, so replacing face-to-face meetings by hybrid meeting when it's possible, reducing the number of people that are traveling missions to the countries, and without reducing the opportunities that we offer to member states to participate in workshops, training, and other process to increase their capacity to advance the public health agenda. So thank you, Mr. President.
Thank you, Dr. Barbosa. Your comments well appreciated. I would now like to inform the subcommittee that the discussions will be reflected in the final report. Ladies and gentlemen, I believe we can now take the break that was advertised earlier. All right, thank you, and I look forward to seeing you shortly. 10:30? Okay. Right. Okay, so it's 10 o'clock now, so you have 20 minutes break. So I'll see you shortly. Okay, welcome back. I believe we have everyone here, so we're about to get started. I hope you enjoyed a hot coffee and enjoyed some good fruits, as I did. So we'll now move straight into the other agenda items. I now refer you to item number 4.3, update on the appointment of the external auditor for PAHO for the period 2028-2029. I would like to bring your attention to document SPBA 208 to the attention of the subcommittee and invite Mr. Christos Kapantoni, Director of the Department of Financial Resources Management of the Pan American Sanitary Bureau, to come to the head table to present. Dr. Kapantoni.
Thank you, Mr. President. Mr. President, Director, members of the SPBA, allow me to provide an update on the appointment of the external auditor for PAHO for 2028-2029. In accordance with the Regulation 14.1 of the Financial Regulations of the Pan American Health Organization, the Pan American Sanitary Conference, or Directing Council, appoints an external auditor of international repute to audit the accounts of PAHO. The current external auditor of PAHO, the Office of the Controller General of the Republic of Chile, was appointed by the 60th Directing Council for the 2024-2025 and 2026-2027 biennia. The appointment of the Office of the Controller General will expire upon completion of the audit of the 2027 financial period. Best practice recommend that external auditors hold a time-limited appointment to ensure transparency and objectivity while taking into consideration the efficiency of the audit process. Taking due note of best practices regarding the provision of external oversight services, as well as satisfactory work of the current external auditor, the Director of the Pan American Sanitary Bureau recommends the extension of the appointment of the Office of the Controller General of the Republic of Chile for an additional 2 years to also cover the 2028-2029 biennium. The extension of the appointment will ensure continuity and effectiveness in the audit of the organization. In accordance with established procedures, during 2028, the Bureau will issue a note verbal to member states, participating states, and associate members requesting nominations for an auditor of international repute to be considered by the governing bodies for appointment as the external auditor of PAHO for the 2030-31 and 2032-2033 biennia. The subcommittee is invited to take note of this document and provide any comments it deems pertinent. Thank you, Mr. President.
Thank you, Mr. Kapantoni, for your report. The subcommittee is now invited to offer comments as you deem pertinent. The floor is now open to you. Okay, the floor recognizes Brazil.
Obrigado, senhor.
Thank you, Mr. President. Brazil expresses its gratitude for the update. The microphone is off, sir. Could you please let her know? It's back on. It's back on. So we welcome this update. We attach great importance to the positive assessment of the Pan American Sanitary Bureau in connection with the work done by the external auditor in charge of Chile. Taking this into account, Brazil agrees in saying that the mandate of the general auditor be extended for an additional 2-year period in line with the financial regulations. After the 2 years, we hope that PAHO will be once again capable of finding an external auditor with the technical repute and the necessary knowledge for the performance of this important function. Thank you very much, sir.
Thank you, Brazil, for that intervention. recognizing that the auditor has indeed performed the roles satisfactorily to PAHO, and that they are requesting an additional term, and so we embrace or accept your concurrence. Do we have any other comments? All right. Then may I ask Dr. Barbosa if you have any comment you wish to make? Thank you.
Thank you, Mr. Presidente. Gracias. Como foi
Thank you. As was presented by Mr. Casapantonio, the Controller General of the Republic of Chile has performed in a very suitable way their role as external auditor of the organization during this biennium. And so we are seeing that it takes a bit longer at headquarters, but also in the country offices that they have visited in order to become fully acquainted with all the processes that are carried out by the organization. Just like the previous external auditor that used to be the national authority, the Controller's Office in the UK, the auditors of the Controller General of the Republic of Chile have carried out a very interesting process, and therefore I believe that it would be in the best interest of the organization to extend this for an additional 2 years in keeping with the current regulations, and later on we will follow the selection process in keeping with the rules and regulations. Thank you.
Thank you, Director Barbosa, for your comments. And I wish to inform the subcommittee that the comments that are placed on the record will be reflected in the final report. And so I wish also to add my voice to say thanks to our external auditors for the contribution, for the good work, and we encourage them to continue as the cycle is being extended, that they too will continue to act with a high level of prudence and efficiency as they continue to offer service to the organization. Thank you. I now move to the next agenda item. That's agenda item number 4.8, amendment to the terms of reference of the Audit Committee of PAHO. I would like to bring document SPBA 2013 to the attention of the subcommittee and invite Dr. Miguel Bonnier, legal counsel of the Pan American Sanitary Bureau, to come to the head table and present the item. Dr. Bonnier.
Thank you, Mr. President, members of the subcommittee, director, and colleagues. It's my pleasure to introduce the proposed amendments to the terms of reference of the Audit Committee. These terms of reference define the framework within which the Audit Committee carries out its advisory functions. As I mentioned earlier today, the Audit Committee was established in 2009 by the Directing Council as an independent advisory body to the Director and to Member States through the Executive Committee. It provides advice on the organization's financial controls, reporting structures, risk management processes, and other audit-related matters. Since the adoption of the committee's terms of reference 15 years ago, oversight practices have continued to evolve, and PAHO's internal control and accountability framework have further developed. In light of these developments, the Secretariat and the current members of the Audit Committee work closely together to undertake a detailed review and to ensure that the terms of reference remain aligned with the oversight best practices and also reflect the committee's experience in actual practice. The Secretariat also reviewed the terms of reference of similar audit bodies in other international organizations as a benchmark for this proposal. In this context, please allow me to briefly highlight 4 key areas where updates have been proposed. First, the revised terms of reference provide a more comprehensive description of the committee's advisory scope, including its engagement with risk management, internal and external audit functions, evaluation, investigations, and the broader system of internal controls. Second, the amendments reinforce provisions related to membership and professional expertise, including qualifications, independence requirements, and the experience expected of members serving on the Audit Committee. Third, the revised text strengthens procedural provisions, including arrangements for meetings, reporting, access to information, confidentiality, and the management of potential conflict of interest. Finally, the amendments introduce a formal requirement for periodic self-assessment by the Audit Committee, consistent with recognized good practice for independent oversight bodies. Together, these four updates strengthen the effectiveness and transparency of the Audit Committee and support the organization's broader governance and accountability framework. The subcommittee is invited to review the proposed amendments contained in the document before you and provide any comments it deems appropriate, including recommendations to the Executive Committee. Thank you.
All right, thank you so much, Mr. Bernier, for your report. I now invite the committee to offer comments. Thank you. The floor recognizes Canada. Canada, you now have the floor.
Thank you, Mr. President. Canada recognizes the important role the Audit Committee plays in strengthening PAHO's governance, accountability, and transparency, and we strongly support efforts to ensure its terms of reference are reflective of current internationally accepted principles and best practices. Overall, we see no issues with the proposed amendments. However, we do have questions on a few of them. Under membership criteria, it stipulates that members of the Audit Committee must not have served as delegates, which we consider to be broad. Can the Secretariat confirm whether this is intentional or if this should be better defined to ensure we are reflecting correct parameters? For instance, served as delegates to a PAHO governing body meeting. Under responsibility of members, language has been added that specifies that members are protected from actions taken against them as a result of activities carried out in their official capacity. Can the Secretariat please clarify who members would be protected from and what this protection entails? Finally, we note that there is no mention in the terms of reference of the committee developing a work plan for the year, and we want to see clarity on why this might not be included. Thank you.
Thank you, Canada. Okay, so Canada have 3 questions. I would want to ask our legal counsel to respond to them. The first one had to do with delegates, eligibility to serve and so on. And the other one has to do with protection from actions, and then the work plan. Or should I invite Miguel to respond? Okay. All right, so Miguel, we'll invite you to respond to these questions, please. Thank you.
Thank you, Mr. President. Thank you, Canada, for these questions. Very precise, it's helpful. The membership criteria to not serve as delegate is intended exactly as you suggested. We're happy to precise this further in the proposal. It's to cover delegates serving on governing bodies of PAHO, not of other governing bodies. And here the highlight with this is to be sure to have the separation, and the proposal also includes separation from the Secretariat in a time before and after the serving on the Audit Committee. So we're happy to revise this to precise this language. In relation to the protection of the activities, this has been a request of the Audit Committee for some time, I must say, and it has to do with to what extent the functional immunities of the organization would apply to members of the Audit Committee, and is to clarify this aspect that their functions in the Audit Committee is a function by the organization, and they are protected in this sense through the functional immunity that members accord to the organization. This obviously does not apply in situations of gross negligence or when they're acting in their personal capacity. And here you ask Canada in protected from whom. This is jurisdiction from any jurisdiction that, say, could initiate proceedings against recommendation from the Audit Committee, and just explaining that this is organizational work, and then it's not normal organization treatment on this. And then in relation to the last question with respect to the work plan, indeed there is no provision to member states of the work plan that the Audit Committee intends to take. So before, what happens is that they report each year on an annual basis to the governing bodies. So let's say it's a reporting backwards. But this is something that we can look into it if there's a specific proposal from Canada. Thank you.
Thank you, Dr. Bonnier. I also wonder if it is necessary, given the independence of auditors, that if you were to give them, or if they were to be presenting a work plan, that might cause a problem for them, because they might want to, at the beginning of each cycle, determine for themselves what is necessary at that point in time. And so the spot checks and all of the various body of work that they might want to undertake might well be compromised if it is told upfront as to what they intend on doing. So I think there might be good wisdom in them not so doing. Dr. Barbosa, do you wish to comment on this, please?
Yes, thank you. Thank you, Mr. President. First, I want to thank Canada, I think, for the very useful suggestion. I think that this is really the idea. This, as Mr. Bonnier informed, the terms of reference are 17 years old. So this was a discussion between the Secretariat and the members of the Audit Committee about how to update the term. But I think that we have a very good opportunity between this meeting and the meeting of the Executive Committee to receive suggestions from member states how to improve the language, because sometimes when we are writing something and after 10 discussions, we believe that everything is clear, and it's important to receive this kind of outside opinion so we can improve the language and to make it more clear some aspects as the delegation of Canada has raised. Just to remind our member states that are not familiar, the Audit Committee is part of the auditing system that you have in PAHO, that encompasses also the internal auditor, that is an independent office but belongs to the Secretariat, and the external audit that we mentioned in the topic before, that is a completely external body that is selected, and after the selection is hired for the organization for a period of time. This audit committee, they serve in a voluntary basis to PAHO. They are selected among, in general, people that have served or is serving in other international organizations. So the idea is that as the audit committee, they have an oversight role to this system that works with different aspects to provide independence, but also that they will be ready to perform all their tasks and report to the member states during the executive committee meeting. Thank you, Mr. President.
All right. Thank you, Dr. Barbosa. Committee, may I inform you that the comments and observations will be reflected in the final report. At this time, according to the agenda, we would have the opportunity to take a lunch break. But because we were so efficient with time this morning, I want to award you by asking your indulgence in moving on to another agenda item, item 3.1, and that will allow us to even finish earlier. So I think I want to propose that we move to agenda item 3.1. Do we have agreement? I see a positive nod, and thank you so much. Item 3.1, outlining of the end of biennial assessment of the program of PAHO's program budget 2024-2025, final report on the implementation of PAHO's strategic plan 2020-2025. I would like to bring, therefore, your attention to document SPBA 22 to the attention of the subcommittee and invite Mr. Ronnie Meza, Director of the Department of Planning, Budget and Evaluation of the Pan American Sanitary Bureau, to come to the head table and present his item. Mr. Meza, the floor is yours.
Mr. President, Director, distinguished delegates, colleagues, I'm pleased to present the outline of the end of biennium assessment of the program budget that was just concluded last biennium, 2024-25, but also the final report on the implementation of the PAHO strategic plan that you approved back in 2019, and that covered the period 2020-2025. Allow me to start by saying, Mr. President, how pleased I was to hear your opening remarks, such aligned with what we do here at PAHO. Through the strategic plan and program budget implementation, it's about accountability for results and resources, but also learning and opportunities, reflecting on challenges, but moving forward on opportunities that can be seized to continue to improving health and well-being, touching and saving lives. Thank you so much for that. First, allow me to, and the document before you is very brief, as this is the first time that we share with you what will be contained in that report that will be presented to you in its full entirety at the Executive Committee as a first draft, but here we are presenting to you what that content will look like, and to hear from you, of course, on your good insights and suggestions. First, this organization is a results-based management organization, and therefore we account to you, the member states, by reporting on the implementation every 2 years on the program budget. This report will not just be on the program budget that we just completed last biennium, but it will also cover the full entirety of the strategic plan, which is also important as we close one planning cycle and we begin a new one. So the opportunities, again, to look at where we have identified challenges, but also lessons and best practices to move forward. It is a statutory report. When the strategic plan is approved, the directing council, the member states ask our director to present these progress reports on a biennial basis. As such, we focus on accountability and transparency as we continue to build on those efforts under the leadership of our director and commitment to you that every dollar invested in the organization has a great return and value to improve health and well-being. That is our business here. it's important again to recall that this is a strategic plan and program budget of the organization. Both member states and Secretariat have the responsibility to develop it, to implement it, and to take stock. So we're taking stock jointly here with you. Of course, we, your Secretariat, facilitate, but based on the evidence that we also gather from our technical teams, but also from the countries. And I will elaborate on that a bit more in the subsequent slides. The report will feature the following sections. We will provide a sound analysis on the financing and implementation of the program budget. It's important, as you saw the particularities that we're facing, as highlighted in the opening remarks of our director and my colleague, the Director of Finance, and also how we fare off when it comes to financing, but also implementing the program budget under such circumstances. We will look at risk analysis, which is something that we have integrated into the program budget and the strategic plan to identify proactively, but also to manage proactively with mitigation measures. So we'll account for those risks that were identified since the beginning of the strategic plan, and update on where we have implemented and where we also had gaps to continue improving. On efficiency, transparency, and accountability, that section on accountability for results and resources, we will analyze also where we were efficient and effective, and how we continue building on these important commitments to your member states on the prudent and responsible use of resources, but aim at delivering results. Lessons learned and recommendations is a key section that, if my memory serves me right, we included about 6 years ago to not just account for what happened, but also what we have learned as an organization that is based on knowledge and evidence, how we use that learning, but not just to document it, but to improve moving forward. And delivering results, which are left there at the center because all of it is tied to results. We will account for all the results levels that we have in the strategic plan, from the impacts, outcomes, and outputs, and the measurement through the indicators. So we have targets for that, and we have a long experience with you, our member states, developing those indicators and their measurement with targets that we also have learned a lot on how we continue to be realistic, recognizing that the context is an evolving one at the country level and at a regional level, but also at global level. This is our timeline, and I just want to highlight here on the first part that you see with a slightly gray, if you can see that from the back, that we have conducted the first step. This is the timeline that starts from the top and moves down with the key steps and milestones. The first step was the internal assessment. We have an established institutional practice here under the leadership of our director and executive management to conduct assessments, performance assessments, every 6 months. And when a biennium is concluded, we do a more comprehensive exercise to see how we perform against all the levels of the results. And this, I will be pleased to share with you some highlights of that internal assessment, bearing in mind that this is still preliminary. So this was conducted between January and February. And today, we are presenting to you, of course, where we are, but also how we'll proceed forward. We highlight here the joint assessment. As I mentioned before, the strategic plan and program budget is a shared responsibility between member states and the Secretariat, especially for impact results that would reflect improving health and well-being, reducing mortality, morbidity, but also at the outcome level, where we will look at where are we increasing coverage, where are we having challenges with tackling gaps. And that can only be done, of course, if the actions are taken at country level. And that's why it's important that we do that joint assessment with you. This is, again, for those, I see a couple of faces here that were back with us in 2014 when the joint assessment was established in this organization with member states. And we have continued to build on that experience. This is a unique practice that we have in PAHO that we don't see in any other international organization that we know of. So I'm pleased to say that over 30 member states, we launched this process last month, and I'm happy to say that over 30 member states have confirmed their focal points, and by I say member states is the national focal points in the health authorities. And I think a couple of you are serving in that role, so if you also wish for us to engage while you're here, and any questions you have, but this is also done in collaboration with our country offices. Our PAHO representatives are the ones leading that exercise, and they are available to continue working with you to ensure that we have a very good understanding and validation of the results here with the member states, reflecting what is happening at country level. We will then continue, once we complete that phase of the joint assessment by April, we will continue to consolidate, analyze, and produce the first draft of the report, which will be presented to the Executive Committee in June, as you can see here, and that's the next iteration for governing bodies. After that, and once we get the feedback from the Executive Committee, we will then proceed to finalize the report. At that time, between June and July, really, because the report has to be submitted so that you member states, the full membership has enough time to review it. We will aim to finalize that by July for any fine-tuning, any validation that we need to do of any results that require further consultation, so that we can have the final draft full report presented to you at the Directing Council. So that would have concluded the overview of the outline, and we would invite your comments on that. But we felt that you coming all the way to Washington and the opportunity we have here, and as we say in the document, to share with you some preliminary results. So you get a flavor of what we're seeing here from the first internal review that we did here with our senior management and colleagues across. I just forgot to mention that that exercise is done with the entire House, both from regional, sub-regional, and country level. All our leadership and teams connect, and we have a full discussion here, which is a 2-day discussion on reviewing results and what we have learned and where we can improve. So if you allow me, I will go into the, I will start with, and again, these are preliminary results subject to the final review with member states, but also as we validate some information, we would want to make sure that we have the latest information available. And on the financial figures, again, as my colleague, Director of Finance mentioned, those are preliminary figures, again, subject to the final audited statements. Here you can see the summary of the impact indicators. There are 28 impact indicators in the current strategic plan. And the first lesson learned from that, and the Director has been very clear with our member states and internally, first lesson was that we needed to integrate, to have less and less, a more integrated approach to this, and that lesson we have learned and applied in the new strategic plan. For those of you who have been part of that process, know that. For those of you who are just hearing that, we can see it in the new PAHO strategic plan. There's a more consolidated integrated. But the next thing was being realistic, that while these targets serve to motivate our collective work towards improving health and well-being, that we had to be realistic and recognize that a plan has to be aligned with the reality on the ground and in our countries and the region, but also external factors that may affect it. We can see here, and we are following an analysis here of where was clear achievement, 5 impact targets, and these are where we see improving health and well-being, especially when we see reduction in mortality and morbidity. And I would just like to highlight some of them, as you will get the full details in the report that you will see for the Executive Committee. Important to recognize that despite the challenges we had, right? We had a pandemic, we had several emergencies that impacted our countries, but we also faced with the investment in health, which peaked, of course, in the pandemic and then went down after the pandemic. And also here in the Secretariat, we also had some challenges in funding the program budget. But this is at member state level. Usually, this would only happen if actions are taken at country level. The reduction, and let's celebrate, I think it's important to celebrate those achievements, the reduction in health inequalities within countries. And that's something that we see that was achieved. The reduction in neonatal and under 5 mortality, and the case fatality of dengue was also reduced, and mortality due to poor quality of air indoors and ambient air pollution. Those we have been able to review with our technical teams, and we can see. Now, where we see what is going on the right track, we also want to highlight here that the development of children, especially for those under 5, the violence, although not enough, violence, especially against women and girls, and mortality due to poor sanitation and water quality. That's not important. That we see progress there, not at the rate that it was planned for, but there's progress. Where we see what you see there in orange in the wrong track, I will highlight a few of them. One of them is maternal mortality ratio. That keeps being a challenge, and we'll reflect on the analysis, but also opportunities as we work with member states to improve that. The mortality due to quality of care, premature mortality due to NCDs, and homicides among the youth. Those are just some highlights of what we are seeing now, and we will present further details in the full report. Where it's in the wrong track, meaning it's not moving forward, actually perhaps regressing, road traffic injuries, deaths, mortality due to traffic injuries, suicides, the measles, TB, and congenital syphilis, just to highlight a few. And then the one in blue, here, the 3 indicators that we had no data, so we cannot assess it. And the first lesson there was that we must not. And that was a message that came from your member states, including indicators that do not have data, we're not able to measure, but rather build the capacity in countries to measure them. Here we have the issue of mortality due to emergencies. That's something that was a WHO indicator, and we removed it from the next strategic plan. But we also had the challenge with proportion of adults who are care dependent, not enough data there, and the bloodstream infections due to MMR. Those are important to celebrate, though, as we highlight that to you, is that when we started the strategic plan, there were 6 indicators at that level that had no data, so we were able to cut those by half. So only 3 were left, but those 3, again, will not continue going forward. In terms of the assessment of the outcome and output indicators, we again, jointly, this is the responsibility jointly with member states. Our internal assessment indicates that about 74%, if you look to the left of the outcome indicators, 105 indicators, about 74% are achieved or partially achieved, with 53% partially achieved. This time we are including, we open the category of partially achieved so that it was not binary, to recognize that, and that's a feedback we got from member states, that it was not just about achieve or not achieve, but where we saw progress, that's being analyzed as well, and that's why you see that gradient of green to yellow, and we will do further analysis on where we also see improvements in member states or progress towards the targets that were set. At the output level, you can see there about 89% of partially of 143 indicators, partially or fully achieved, and again, opening that partially achieved categories that we can also document where member states are, or we, the Secretariat, are making progress. Of course, as you can see at the top, we have also that percentage that was not achieved, subject to validation, again, based on the joint assessment. Turning on to the budget and financing of the program budget. First, this is, as I mentioned in the opening, we will focus on program budget 24-25, which is to the right of the screen. But we will also do a full analysis of the 6 years of the strategic plan. And here are the preliminary figures that you have for those 3 biennia or 3 program budgets. And the first point that is important to clarify always here on how we manage the program budget is a space that is to be financed, and therefore you see the blue bar is usually what member states approve, and then here in the Secretariat, well, of course, we rely on your assessed contributions, but also the resource mobilization. And then you will see that the green bar shows how we did in terms of financing that budget space. And then in the orange, you will see the implementation. The bottom bars, the bottom part of the bar shows the base programs. That's the core, where we have the priorities agreed with member states. And then at the top, you have what we call the special programs, which is normally dependent on emergency funding when we have to respond to emergencies. And you will see that in the middle there for program budget 22-23, you will see that we had the largest budget, but also the largest financing, and that the top bar there, the top section of the bar reflects the additional funds that were mobilized and received to respond to the pandemic. And then you see the trend going down again when we started recovery and fully into 2024. The other important part of these bars is, and I would like to highlight, is the bottom part of it, the base programs, where the regular technical cooperation, the one that we plan, the one that we can jointly identify priorities with you and how we work. You can see as well that that green bar at the bottom continued to increase in terms of financing, and that's important. The core program budget increased from $479 million in 2021 to $643 million to implement, to respond again to those priorities that you approve in the program budget. But also important to note that trend on implementation, and I will also focus on base programs, that $442 million implemented in 2020-21 and ending at a 611 implementation, which is about $69 million increase. And that reflects the capacity first to mobilize and to implement with responsibility. Of course, this implementation is dependent on many efforts from our staff, but also the great collaboration of member states. Also important to note here is that the program budget, as you would notice, had a gap. Between the blue bar at the bottom and the green bar, there's a gap, and I want to focus on 24-25. The director has already commented on the gap that we had, but as you can see there, from the approved budget in base program, $700 million, we were able to have $643 million. That's a $57 million gap to implement the program budget that you asked us. How did we manage? I think my colleague, Director of Finance or Director has a little bit. It's important to note this. The cost containment measures, ensuring that we find ways also to implement partnerships with member states with implementing on the ground in new ways of implementing. Also intensifying resource mobilization. And important here also, those cost containment measures on being prudent and responsible. The director mentioned on how it yielded $23 million in cost containment that in a way compensated for us to continue to respond and fully implement the program budget. Of course, that only goes as far as it can go with efficiencies and additional efforts, but no voluntary contribution can replace the value and criticality of assessed contributions. We welcome, we appreciate that, but the flexibility of your contributions allow us to direct that funding to priorities. It really helps us to remain country and priority focused and results focused. With that, let me just show you that while that overall funding looks solid, given the circumstances and that the implementation was over 90% across all biennium, we didn't have the same level of funding, of course, across all priorities. Here is the overview of the cluster of outcomes from communicable diseases to the left, determinants of health, health emergencies, health systems, information systems and evidence, non-communicable diseases and risk factors, including mental health and violence, and then the leadership, governance, and you will see from this graph here that we had significant gaps in funding, especially in two key priorities that member states always identify as their high priorities and where they want PAHO to maintain that attention. It's health emergencies had a gap, one of the biggest gaps that we can see in the implementation here of $36 million. Budgeted 107, but we had 71 million funded. Implementation, as you can see, the yellow bar was consistently high across all clusters. The other priority, high priority of member states is NCDs, risk factors, mental health. That cluster achieved about 75% of its funding with a gap of 17 million. Again, our teams, the collaboration member states allows to continue responding to these priorities in a way that we can maintain certain level of technical cooperation, but that alignment of funding and priorities is not new. I want you to know this is something that we monitor very closely here and make every effort, like the innovative approach that our director highlighted with Spain, not just giving voluntary contributions, but core voluntary contributions where the director can then allocate those resources to these priorities. That's an opportunity for us to respond to you, member states, to where you would want PAHO to focus its technical cooperation. Also, another lesson we have from here is budgeting. We've also learned that not all are equal. We cannot compare one cluster to another, but also that we reflect realistic budgeting. And as you heard, going forward, we have proposed a reduced budget. I would like to take the opportunity, with your indulgence, Mr. President, to go over something that is important for us as we discuss in this subcommittee on how we continue to build on efficiency, transparency, and accountability. We have launched last year in the development of the strategic plan, the PB digital portal, the program budget digital portal, but we made it more comprehensive so that you can see all the information in one place, from the strategic plan to evaluations, external evaluations. This portal, you can access it from the QR code that you see there. You will see again the strategic plan, all the current and the previous, program budgets, the current and the previous, and then program budget implementation reporting, including results reports, and our external evaluations, which is another key feature on how we continue to build on our results-based management culture, but also a strong evaluation culture that allows us to continue improving our performance, learning, and also increasing our accountability to your member states and our partners. Let me see, I'll try to go directly into the digital portal. Here it is. You will see the same landing page that I just showed you. If you click on Visit Us, you will see the details that are underneath each of these big topics. Here you will have the opportunity to see the strategic plan that you approved last year after intense discussions and consensus building with member states. You will have the program budget, so you can click, and I will click on the program budget 24-25, where we will be producing this report. And you can see here the details, an executive summary, the structure, and also country overview. We're also including here country success stories. You will see on the results report, but you also see the country level work and how the Secretariat contributes to improving health and well-being from the country, but to the regional and the collective regional priorities that we agreed. On the, let me go back to program budget implementation, and I will show you now numbers that you just saw. When you go to this link, you will see, again, the figures. You can see those are the same figures that I just presented to you, but in an easier way to view, where you can see 95% of implementation of the last biennium, which is the highest, by the way. Although we had more money, we implement a higher level. We also can see details of the previous program budgets, if you want to compare. You can also see details by the outcomes of the strategic plan, how the level of financing and implementation as you need. We can also go to see something to give also thanks and appreciation to our contributors. First, our member states for their assessed contributions. That's the first. How is the program budget financed? You will find this very nice graphic here that provides all the funding sources and how they contribute to the program budget in proportion. But also you can see where are the figures of the assessed contribution, how much is paid by each member state, and so on. And then voluntary contributions, recognizing again, and thanks again to our partners who continue to support the organization. All those details are there, and I will leave it there for you to continue with. Please explore it, and if you have any suggestions that will help us to improve, we will welcome them. With that, Mr. President, thank you very much. I'll be happy to address any questions.
Thank you, Director Meza, for your very comprehensive report. We appreciate the fact that you went into detail. I think that helped us to refresh our minds and to get a better understanding or more in-depth understanding as to the performance of the program budget. You will recall earlier that we did have, from a country perspective, the two-day meetings that enable us to delve into the program of activities. So again, we want to thank you, Mr. Meza, for your report, and I now invite the committee to make their commendations and interventions. Thank you. Floor is open. The chair recognizes Panama. Panama, you.
Thank you, Mr. President. Panama is grateful and takes note of the proposed evaluation system based on a cohesive system that's results-based focused, following through with the programmatic performance of 2024-2025 in keeping with the strategic plan 2020 to 2025 goals, underscoring the inclusion of efficiency, effectiveness, and equity, with the purpose of strengthening its strategic analytical usefulness. It's very important to stress the impact results basis, focusing on results, inputs, outputs, and people's health, incorporating indicators that show substantive changes beyond just operational compliance. It's suggested also to continue strengthening the alignment with the regional and global frameworks, especially the Sustainable Development Goals and the international health regulations, to ensure consistency in the indicators, international standards. Also, we suggest that we seek to improve the quality and comparability of indicators, promoting their regional standardization, breakdown according to sex, vulnerability, territory, and so forth, and strengthening the analysis of health inequities with a cross-cutting look at human rights, interculturality, and gender matters. As regards resource management, it's deemed important to strengthen the analysis of shortcomings, tying it to the execution of the budget and results achieved, incorporating cost effectiveness as a a factor. We also propose to consolidate the management of knowledge as a cross-cutting axis with best practices and knowledge generated such that we can have feedback into future strategic planning. Also recognize the importance of spurring digital transformation of health, integrating digital health interoperability and information systems as key elements for decision making and institutionality. We stress the importance of strengthening the analysis of governance and sustainability, looking at installed capacities of countries and the level of articulation across sectors, especially in those matters tied to the social determinants of health. By way of conclusion, the current scheme is an opportunity for us to consolidate a strategic assessment that would contribute to strengthening technical leadership of the Pan American Health Organization, decision-making, and to effectively guide the next planning cycle in the region.
Very well, Panama. Thank you for that intervention. Appreciate it. The chair now recognizes Argentina. Argentina, you now have the floor.
Thank you, Mr. Chairman. Argentina takes note of this document, and we do agree that the end of biennium evaluation is an accountability mechanism, as well as looking at the program budget and its execution in the region. We're working with the country office to facilitate the validation and evaluation process in Argentina to carry out a joint assessment over the next couple of weeks for its submission to the June Executive Committee. We hope that the resulting decisions yield results in the strategic planning of 2026-31. Our country has supported the priorities set forth in the 2020-2025 strategic plan, especially that which relates to promoting integrated healthcare, expanding regional capacity in production and innovation, with a focus on non-communicable diseases and the digital transformation of healthcare systems. Likewise, within the framework of the cooperation strategy with Argentina 2024-2028, and in coordination with the country office in our country of PAHO from our health ministry, we are forging ahead in taking on two joint commitments, putting together an advisory board for primary health care in Argentina, along with PAHO, the Inter-American Development Bank, and the World Bank, and intersectoral coordination to prepare and respond to zoonotic influenzas together with PAHO, WHO, and the National Health Service and the food service, along with their environmental ministry. Hope that these efforts will help to prepare for greater preparedness and response in the event of a health event to strengthen community resilience. Thank you.
Well done, Argentina. Thank you so much for those comments. We do appreciate it. The chair now recognizes Brazil. Brazil, please.
Thank you, Mr. Chairman. I would also like to express thanks to Ronnie Maza for the presentation of that report, recognize the importance of this assessment process as key for us to verify the results and the accountability of this organization and of member states. And to that effect, we would like to stress that the Health Ministry of Brazil is currently working in close cooperation with the country office in Brazil to assess the output and outcome indicators. This joint work has been essential for us to qualify the analysis of progress made and to find new opportunities for cooperation and to identify challenges. We take this opportunity to express thanks for the technical support from PAHO and the country office in Brazil as we go through this process at our ministry. This has made important contribution for the dialogue and analysis of the results. We reiterate Brazil's commitment to this assessment exercise and to the strengthening of the monitoring mechanisms, which are crucial to for the next strategic planning process of the organization and to enhance the results of the health indicators in the region. Thank you.
Thank you, Brazil, for that intervention. We now ask Ecuador to take the floor.
Muchas gracias, señor.
Thank you very much, Mr. President. My name is A.B. Martin from Ecuador. Perhaps if you allow me to make two suggestions or two comments in connection with the presentation, it would be valuable for all. And I believe this goes along with the comments made previously by the colleagues that the information and the data are a stepping stone that is essential in our decision-making process and thus to follow the interpretation of the data. It would also be positive to my mind if we could, within that presentation or as a part of the documents that have been provided to us, to understand how the interpretation has been done. What is the achievement, what is to be achieved, what has already been achieved. It is in the detailed document, but sometimes this would be a brief aide-memoire before the presentation so that we can all be kept abreast and be in tune with what is to be presented. And at the same time, another comment that I hope will be considered. Up to 10% of the male population is colorblind. So I understand that I'm not alone in following these statistics. And it is somewhat difficult for us when you're colorblind to deal with the colors that are shown to us. But we understand the information. It is extremely valuable, and thus we are extremely grateful for it. The delegation of Ecuador, obviously, is committed to the work that we're doing at a regional level and cooperation amongst countries, and we express our gratitude and welcome what has been presented to us as to end of biennium assessment and the program budget 24-25 and the strategic plan 2020-2025. As I said previously, Ecuador acknowledges the importance of the programmatic assessment and budgetary assessment in order to beef up transparency and accountability and results-based management, and to analyze the progress that has been reached for the strategic plan 2020-2025, the execution of programs, that is to say the program budget 24-25, which is the software tool that was just presented this morning, which I believe is extremely important in order to have a strategic location of resources for us as a Ministry of Health, not only for PAHO and the country offices in each country, but also for us. This is valuable information when we come to the positioning of resources within the Ministry of Public Health, because we still have persistent challenges in our countries, and not only in our countries, but in the region. The country keeps a permanent commitment with planning and assessment of health and promoting an effective management of resources in order to improve health interventions, because what is not measured cannot be improved. And therefore you can count on Ecuador in order to always try to improve things and to have the indicators that we've set in each one of the committees, and thus be able to improve access to information systems. I believe that we have a stepping stone here where we can work not only within each one of our countries, but also at the time of always being able to share, protecting the personal data in each one of our jurisdictions, but protecting the data that we have in the region. The public ministry in our country promotes results-based management and the strengthening of information systems in keeping with national planning and regional commitments as well as international commitments. And these actions contribute to the regional health priorities of PAHO and in strengthening institutional capacities in order to improve equitable access and the quality of services. Last but not least, the delegation of Ecuador takes note of the subject proposed, so we believe that this is an adequate base in order to promote compliance with the strategic plan 2020-2025 and guide our planning for 26-31. Thank you.
Thank you so much, Ecuador, for that intervention. The chair now recognizes United States of America. Please. All right, there you go.
Thank you, Mr. President. The United States appreciates the outline for the report on the end-of-biennium assessment of the program budget of the Pan American Health Organization 2024-25. We underscore the importance of a rigorous results-based evaluation that clearly shows how resources were used and what measurable outcomes were achieved in alignment with PAHO's core mandate and member states' priorities. A transparent assessment of progress, performance gaps, and remaining regional health challenges ensures accountability and value for money. The end-of-biennium assessment of the program budget should provide evidence of impact identify lessons learned, and inform resource allocation and implementation strategies as PAHO advances to the 2026-2031 strategic plan. As we extensively discussed during the development of the 2026-2031 strategic plan last year, the 2026-2031 strategic plan should advance evidence-based actions to safeguard the health and well-being of member states in the Americas. We especially support the plan's emphasis on strategic objectives that will address the root causes of disease, strengthen primary health care, improve child health, and promote healthy diets. In this context, the joint assessment by the Pan American Sanitary Bureau and member states of progress toward the outcome and output targets under the SP 2025 is particularly important. The process appropriately reinforces member states' central role in evaluating performance, validating results, and ensuring that implementation reflects nationally determined priorities. A credible joint assessment strengthens accountability by grounding performance review in member state oversight and shared responsibility for results. Given the inclusion of divisive gender ideology issues in the previous strategic plan for 2020 to 2025, we must reiterate the biological truth that there are two sexes, male and female. It is essential that PAHO and our fellow member states use clear and definitive definitions for biological men and biological women, recognizing their distinction, and the need to accurately prescribe health outcomes to each biological sex. Finally, references to quote-unquote social determinants of health amount to the application of diversity, equity, and inclusion ideology to health policy. This misguided framework prioritizes income, race, and social background over measurable health outcomes and personal responsibility. So while we recognize some of that language has been used previously, we expect that this end of biennium assessment to be forward-looking and not give recommendations on these divisive issues that have no business being included in PAHO or UN discussions, including when implementing the 2026-2031 strategic plan. Thank you.
Well, thank you. Thank you very much, United States. I now ask Mr. Meza to respond on the comments and observations made.
Thank you, Mr. President, and to the 5 member states that kindly give us their feedback and suggestions, and also their questions to continue improving. Panama, Argentina, Brazil, Ecuador, the USA. Let me first thank you for the overall support to the outline and the clear guidance on how we can continue to finalize the assessment first and then the report. Also, glad to hear that we have good calibration here in terms of the language we use, the results language, value for money, but also where we see opportunities of this assessment to continue implementing the strategic plan that you approved for 26-31, as we indeed, your secretariat here is committed to do that. Also, allow me to highlight that this assessment is not just about documenting, but as I think as Brazil and Argentina and Panama have also highlighted, it gives us the opportunity to engage with your member states, to build collaboration, to reflect on where is it that dialogue with member states is so essential, that we remain focused, of course, on your priorities, on where we, again, the Secretariat adds value through technical cooperation. That is something that is an added benefit every time we engage, and when we look at results, reflecting on also where there are gaps and where we need to orient resources. I think that's important. Well noted in terms of the suggestions, and I also thank you for recognizing, USA, that we do have the new strategic plan with language that has been agreed, and our commitment is to continue, of course, implementing that document that was agreed with you all member states. And thank you again for all the input that was provided. We have clear guidance in that document to move forward. Si me permite, voy a responder a la...
With your permission, I'd like to answer the question addressed by Ecuador in Spanish. First of all, thank you very much. Thank you for your suggestion. Very specific, very much to the core. And this organization believes that this is the only way to move forward when we say things in constructive terms, not only to improve the presentation, but to improve the report. We take note of it. But with your permission, I'd like to clarify things. Sometimes we believe that our jargon is well known to everybody, but let me clarify things. For us, one, in the strategic plan, we set goals and targets for each level of results, impact results of outcomes and outputs. And that has well-defined goals defined with member states and a technical file that allows us to assess with evidence whether it moves forward or not. In keeping with the terms of outcomes and output, we use the terms reached, partially achieved, achieved, not achieved, in the understanding that achieved means that we achieved the goal 100%, or we even surpassed it. If there was a number, let's say that they were going to achieve a coverage goal or a coverage target, if we determine or if we decide that we reached that goal, we say achieved. Even if it was not achieved, if it goes beyond 1%, we say partially achieved. So we're trying to define what the progress was. Between 1% and 99%, that would be partially achieved, and we have to document that progress. If not achieved, well, it means that there was no progress made. Regarding impact indicators, we opened up the categories and also to acknowledge, because in the past we have a binary system, achieved or not achieved. And then we put achieved, would be the goal attained, and that is following the correct direction. It moves forward. It goes to a goal that can be achieved by 2030, 2031, if that indicator continues. And then when there's no progress, or it is stagnant, when there's no progress made, well, it simply leads us to see that there was no movement whatsoever, and that it is going in the opposite direction. Well, it means that there was no progress made and there was some regression in what was planned. And if there's no data, I believe it's clear. Thank you once again, and we will continue moving forward with the report in keeping with your indications and your very positive suggestions. Thank you, sir.
Thank you, Mr. Meza. And you now ask Dr. Barbosa to comment. Thanks.
Thank you, Mr. President. I want to thank all the comments, suggestions made by our member states. I think that this really a very important topic of this meeting, as well as it will be during the executive committee, because it's the way that we can assess what happened in the last 6 years, the lessons that we learned during this process of the implementation of the strategic plan, and to how we can incorporate this lesson in better implementation and to deliver better results and outcomes for member states in the current strategic plan period that we are. I just want to briefly, I think that very positive comments reminding us that we are an evidence-based institution, organization, so we really need to be careful when we are presenting the documents and the plans that all the information that are presented is based in the indicators, the information that we have, and at the same time to avoid what I call to make the planning a wish list. So I think that this was, of course, when we are planning and when we are forecasting, this is always charging that we need to be ambitious. Because if you are not ambitious, we are not moving forward, we are not challenging the countries and our own staff to do better, to improve the outcomes. But at the same time, if you are too ambitious, from the beginning we know that this is not achievable. So I think that it's not the best way to set the goals. So I think that it was a very good exercise that we had with our member states in the preparation for the current strategic plan, based on the lessons that we learned in the strategic plan that we are presenting the results. Let me also remind us that for the period 2025, we need to take into account that this was a period that was hugely affected by the COVID-19 pandemic. Now, as we know, it was not only the direct hospitalization and deaths related to COVID-19, but when we look to excess mortality studies, we had increases in mortality related to cancer, to cardiovascular diseases, and other diseases, because some challenges that the health systems had in the region and in the world that limited the access of the population to healthcare services. So I think that we need to take into account that it was not a regular period. So probably some of the indicators that were not, that didn't show improvement, we can also be related to that. The second lesson that I think that is important, and Mr. Maza highlighted, is that we practically eliminated the indicators that we don't have enough data. So if you don't have enough data, it's better to get rid of that indicator and work together how we can provide the measurement to that indicator, because I think that it's for organization and the national health systems that we have in the region that work based on data and information. If you go to a period of 6 years and you cannot get the data to show that if there was an improvement or not, I think that this is telling us that we need to go probably one step back and to think about how we can establish a better information system. And finally, that I think that when we look to the indicators that were part of the strategic plan 2025, we included, I say we because part of this process, I think that there was participate as a member state. So I think that clearly in the thinking about covering all the areas that can impact the health outcomes, sometimes we are including indicators that the real capacity of the health sector to change the trend is very limited. So, of course, these are important areas, of course they are, but we need to think about how we can clearly highlight that on several areas the health sector will perform a better advocacy, we will establish a partnership with other areas of the government and the academic institutions and civil society in order to move forward that agenda. But the health sector is not directly responsible for the improvement of that specific indicator. So I think that these are important lessons that we learned during the period that are reflected on the strategic plan that was approved last year. So taking into account all of this, I fully agree with the general assessment that the region showed a very important resilience when we had the COVID-19 pandemic, despite that the region was severely affected during different peaks of the transmission, but the national health system learned a lot and established new ways, telemedicine, telehealth, improvement of the point of care diagnosis, improved the regional capacity to perform surveillance, prevention, and respond to public health emergencies. So I think that despite all the problems that now we can clearly see, it was a period that the countries in the region achieved a lot of important goals. So I want to thank the member states and congratulate them for their leadership, their commitment in each one of the countries. Despite of the challenges, we can see that the fundamental indicators like child mortality and others improved a lot, and this is directly linked with our capacity to improve primary health care, to provide better access to all to the population in all our countries. So thank you, Mr. President.
Thank you so much, Dr. Barbosa, for putting a cover on the discussions and for bringing us to this point where we can now embrace all of the comments and recommendations, observations that were presented via the discussions. And all of this will be reflected in the final report. So, ladies and gentlemen, Thank you. All right, so that was a pause so that you can just take a little breather. Yeah. All right. So we have done very well together. Discussions were good, and we were very efficient with our time management. So we've come to a place where we are about to take an unadvertised lunch. But before we so do, I want to also beg your indulgence for this afternoon session. We would want to consider the following items on the agenda. We want to bring up some items from which will happen tomorrow, I believe, into today's discussion, which will be held this afternoon. So this afternoon, when we return, I am asking that you approve that the following items be considered after lunch. Items 4.1, 4.4, and 4.5. 4.1, 4.4 and 4.5 in particular treat with human resource type issues, and therefore it would be good to take them all together. And so I want to ask your indulgence. Do we have agreement on that? I recognize some positive nods, and therefore I take it in the true spirit of democracy that we will discuss those this afternoon. We will break for lunch in a short moment, and before I call on the Secretary to provide some guidance, I would want to suggest that we return promptly at 2 p.m. So you'll have a long enough lunch, give you sufficient time to get through maybe about 75% of your digestion. So I now call on the Secretary to provide some guidance. Thank you.
Thank you, Mr. President. Once again, we would like to remind the heads of delegation that a commemorative photo of the subcommittee participants will take place in Room A as soon as this meeting breaks for lunch. The working group that will review the information on the candidates for the Audit Committee will convene with the legal counsel in a private meeting today, right after the official photo, and that meeting will take place on the fourth floor, room 414, room 414. And lastly, I would like to remind delegates of the briefing session on PAHO Forward that will take place in this room today from 4:30 to 5:30 p.m. Back to you, Mr. President.
Thank you so much. I now have the privilege to officially end this section of the meeting and break for lunch. Do enjoy. Good afternoon, everyone. Good afternoon. All right, good. Yeah, so I trust that everyone had lunch, all right, and we are ready to start this afternoon session. We have 3 items on the agenda that we wish to cover, and I therefore encourage us to continue our participation as we did this morning. With that, I now call the meeting to order and refer you to item number 4.1, amendments to the rules governing the election process for the position of Director of the Pan American Sanitary Bureau. I would like to bring document SPBA 26 to the attention of the subcommittee and invite Dr. Miguel Bonner, Legal Counsel of the Pan American Sanitary Bureau, to come to the head table and present on this item. Dr. Bruno, thank you.
Thank you, Mr. President, distinguished members of the subcommittee, director, colleagues, good afternoon. It's my pleasure to introduce the proposed amendments to the rules governing the election process for the position of the Director of the Pan American Sanitary Bureau. These rules, the current rules, were adopted by the Directing Council in 2006 and have since provided the procedural framework supporting the election of the PAHO Director. Over the years, they have contributed to ensuring that the election process is conducted in a structured, transparent, and credible manner. The current rules establish a process that begins with a formal invitation from the President of the Executive Committee to member states and participating states and associated members to submit nominations for the position of the Director. Each may nominate one candidate from among nationals of the region, and following the closure of the nomination period, the nominations are circulated to member states, participating states, and associated members. Nominated candidates are then invited to present their vision and respond to questions during a candidates forum held on the margins of the Executive Committee session preceding the Pan American Sanitary Conference. The Director is subsequently elected by the conference by secret ballot from among the nominated candidates in accordance with the PAHO Constitution and the applicable rules of procedure. That's the current situation. After nearly 2 decades of application, the Secretariat undertook a targeted review of these rules, building on PAHO's established framework and institutional experience to ensure the rules reflect current best practice. This review also took into consideration the WHO EB Decision 157/9 adopted in 2025, which was informed by consultation with member states. This review does not affect the role of PAHO's governing bodies, which remain the sole decision-making authority in the election of the Director. The proposed amendments introduce instead targeted procedural updates while fully preserving the authority of member states. With this objective in mind, the proposed updates are organized around 3 complementary pillars that we're showing now on the screen, each intended to strengthen confidence in the election process. The first pillar concerns reinforcing candidacy standards. The proposed amendments clarify the qualifications and eligibility expectations for candidates, including senior-level technical leadership and managerial experience. This is reflecting and using as a minimum the qualifications that are requested for D1 or D2 positions. And this is to reflect the responsibilities of the position of the Director. They also introduce a mechanism to verify the completeness and eligibility of nominations once submitted. To support this process, the proposal established an advisory group composed of member states appointed by the Executive Committee. Its role would be strictly procedural, to review the documentation submitted and confirm that candidates meet the criteria set out in the rules. Importantly, this advisory function does not affect member states' authority in the voting process. The second pillar relates to enhancing transparency in the process. Candidates would submit declarations of interest and disclosures regarding campaign support, and would also confirm their willingness, if elected, to comply with the PAHU's Code of Ethical Principle and Conduct. The proposed amendments formalize as well the live webcasting of candidates' forum, broadening access to what we consider to be an important stage of the election process. The third pillar concerns procedural safeguards. Specifically, the proposal would allow the Executive Committee to reopen the nomination period if the number of eligible candidates is insufficient to ensure a meaningful election. It would also update certain safeguards for internal candidates, ensuring the independence and impartiality of the Secretariat, and refine certain post-election measures, specifically the reporting of funding authorizations before and after the election. Taken together, these amendments represent targeted updates to the existing framework aimed at strengthening clarity, transparency, and confidence in the election process. I understand that these are various proposals, and these are presented as a proposal for your comments, so that I think member states actively participate. This is ultimately your decision on these rules. The subcommittee is invited to review the proposed amendments contained in the document before you and provide any comments it deems appropriate, including recommendations to the Executive Committee. Thank you, Mr. President.
All right. Thank you, Dr. Brunner, for your report. I now ask the subcommittee for your interventions. I recognize Canada.
Thank you, Mr. President. Canada is proud of the region's director election process and welcomes efforts to further strengthen the rules governing the election process for the director. While we support most of the proposed amendments, we have questions and concerns with the proposed advisory group mechanism, as well as the contingency for reopening nominations. Regarding the advisory group, we are unclear about the intended purpose and added value of this mechanism. The proposed provision states that this group will confirm candidates' eligibility. However, this seems to duplicate the Bureau's function during the compilation process. Can the Secretariat clarify the specific concern or gap this new mechanism is meant to address? We also consider that a few elements of this proposed provision may require further precision, including group composition and language around alternates and timing in which the EC appoints this group. Regarding contingency for reopening nominations, we believe further consideration should be given to criteria for determining what constitutes a meaningful election. As written, the provision implies the EC's decision on whether an election is meaningful is based on number of eligible nominations alone. If a minimum number is considered, it should be established as a priori. Nevertheless, we believe the essential consideration should be quality and suitability of candidates, not quantity. For example, if a director seeking a second term runs unopposed, the election only has a single candidate. And would that not constitute a meaningful election? We would not expect the EC to reopen nominations in this case, indicating the decision would not actually be made based on number of eligible nominations. We want to ensure we are not impeding an election process to move forward in situations where number of candidates may be limited but fully qualified. Thank you.
Thank you, Canada, for that intervention. The chair recognizes Grenada.
Thank you, Chair. I wish to offer some brief comments on behalf of Grenada in relation to the text of the document under consideration, SPBA 20-6. In general, the rules outlined can be described as acceptable. However, I would like to draw attention to one specific provision. Under Article 1, subsection 1.2, it states that the candidates must also confirm their willingness, if elected, to comply with PAHO's Code of Ethical Principles and Conduct. If compliance with PAHO's Code of Ethical Principles and Conduct is an expectation for the elected candidate, this requirement could be stated more directly. The phrase willingness to comply appears to introduce a degree of flexibility that may not be intended. Consideration may therefore be given to strengthening the language to reflect a clear obligation rather than an expression of willingness. I remain open should my interpretation of this subsection be misplaced. Thank you.
Thank you, Grenada, for that intervention. The chair recognizes Brazil. Oops, sorry. United States would have to come back in because, yeah, right, sure, okay. Yeah, all right, go ahead, Brazil. Sorry, that's a little confusion there.
Obrigada.
Thank you, Mr. President. Brazil would like to thank you for submitting this document and acknowledges the efforts to improve the process for the election of the Pan American Sanitary Bureau. We consider that the proposal presented represents an important step forward in strengthening the transparency of the organization's electoral process. Brazil also recognizes the importance of establishing minimum qualifications for candidates, with the aim of ensuring that the elected person has the experience and skills appropriate for the role. At the same time, we would like to stress the importance of applying such criteria in a balanced manner so as to preserve the diversity of candidacies amongst member states. Brazil also views positively the proposal to establish an advisory group to assist the Executive Committee in reviewing candidate eligibility. We understand, however, that it will be important to ensure that this mechanism operates in a strictly technical manner with clear criteria. In addition to that, we would like to raise two questions regarding the possibility of reopening the deadline for the submission of candidacy. First, are there other international organizations that allow for such an exception? And second, what would constitute a sufficient number of candidates to guarantee a genuine election, and who could invoke this possibility for consideration by the Executive Committee? Finally, we reiterate Brazil's support for these initiatives to strengthen governance and transparency of PAHO's institutional processes. Thank you.
Thank you, Brazil. The chair recognizes United States.
Okay, great, thank you. Thank you for the opportunity to review this important process to select a new director. Something as important as changing the rules for electing the director cannot be inserted at the last minute. So we would like to remind the Bureau that the rules of procedure for all governing bodies, including SPBA, require providing all written documents at least 6 weeks in advance of sessions. So we would request that for all future meetings, the Bureau meet that established timeline. While we have not had sufficient time to review and consider the report, we can provide initial feedback. The United States appreciates the Bureau's careful review of the rules governing the election of the director and welcomes the proposed amendments to further strengthen transparency, integrity, and procedural clarity in the process. These updates help reinforce member states' confidence in the fairness and credibility of the election framework. We also welcome the effort to modernize the process, including enhanced disclosure requirements and measures to support transparency, such as the webcasting of the candidates' forum. These steps support informed decision-making by member states. The United States notes that merit should be the main consideration for all PAHO positions, and we appreciate PAHO's focus on merit-based qualifications in these procedures. The United States will assess candidates on the readiness to work and partner with us on PAHO reform and other U.S. priorities. Thank you.
The Chair expresses appreciation to Member States for your contribution. I now ask Dr. Bonner to respond. Thank you.
Thank you, Mr. President. Thank you, Canada, Grenada, Brazil, and United States for the comments. There were some specific questions, and I'll just go one by one, so I think that's the easiest. So I think Canada started on the advisory group. I think you raised a really good point. And so what is the added value when the Secretariat is also looking for the completeness of these applications? The goal here, and it's for you to guide us, is to make sure that it always is a member-led process, and it's not the Secretariat doing this alone. And it's to give, I think, authority and space for member states to review by themselves the completeness of the applications and then inform member states by member states the discussion. There is, I must say, there is a concern with the balance of this on the advisory group, and that's precisely why it was specified what exactly the advisory group is to do, because from an institutional perspective and legal as well, we wanted to ensure that the authority of the conference is not changed in any way with this process, right, by the advisory group. That's why we wanted the advisory group to do a confirmation and then share this information for the conference to decide. But we are open to any specific feedback on this. We're happy to adjust as we go forward. These, again, as I said, these are proposals. And the I think Canada also asked about the composition and what the specific attributes I just mentioned. But the composition, these will be 3 member states in part of the advisory group, and we are proposing that alternates also be nominated in case a member state nominates a candidate that member state is not part of the advisory group, precisely to ensure there's no a perception of conflict of interests in the work of the advisory group. In relation to the second point that Brazil also asked in terms of the criteria for a meaningful election, I'm going to say we had looked into other examples and a lot of thinking behind this, and the notion is not to have, purposely not to have a numerical minimum. And we wanted to use this term meaningful because it's for member states to decide what is meaningful at any given moment. As I think Canada raises a very good point on, well, should be a re-election or just a small number of candidates, but these candidates are really strong, and member states consider this, that, you know, a small number with really strong candidates is meaningful. That's member states' decision, and this would be a decision by member states. It would be a decision, because of the sequence of the process, it needed to be a decision by the executive committee, so member states of the executive committee. The proposal is purposeful on the sense of using a term meaningful without defining what a minimum, or in terms of the qualitative assessment as well, precisely to allow the member states space to decide this for every election. And this is the balance we try to propose. We're happy to inform and adjust as member states decides on this. Grenada, thank you for the comments. You raised a really good point on the wording of willingness to comply, right? This is the wording. where we saw that the original wording was in a particular way, and we were trying to be respectful to the current rules and not change a lot. So only where we saw, I think, a clear institutional legal advantage to change. But it's a very good point. It's just that the current wording says willingness to comply on the declaration of interest. So the wording was there, just kept, but this can be adjusted on the proposal, and I think Granada makes I think a very good proposal on turning this into, I think, a clear obligation, as you shall do it, and it'll be good to get input in this from other members as well. Moving to Brazil, com relação aos parâmetros.
In connection with a qualification, it's important to look into that because this is precisely related to the possibility, the responsibility of this position as a director. And it was an element that we saw entailed a certain difference for high-level positions in the management of the organization that demand certain qualification in terms of a management serious experience, and something that was not included in the qualifications of the candidates to directors. And we consider this as the basis, the minimum, that is for the position of director. Now, in connection with the reopening of the process, I've already dealt with the minimum basis of it, that it is not purposeful, that it doesn't have a minimum number so that member states can decide on that. And when can we invoke this? It is necessarily in keeping with the process that is followed. It must necessarily be during the executive committee that comes before the conference. So it has to be through the discussion that takes place in the executive committee, and the president of the executive committee ought to consider that reopening. And then the other dates would have to be adjusted accordingly, proportionally to the rest of the election.
The United States, thank you for the comments. The two specific ones on the qualifications for candidates for the director posts are with this really in mind in terms of a merit-based qualification. I take note of the 6 weeks in advance. We'll make sure to provide the documents with sufficient time for consideration of all member states. And we benefit from this process, and I think it's very helpful that we have the subcommittee looking at it first and then the executive committee, because it's going to go through all the way until the directing council should member states think that this is appropriate. And I think I stop here. Happy to address further questions. Thank you.
All right, thank you, Dr. Bonnier. You were able to answer all of the questions. Well done. It means that your lunch was sufficiently nourishing. All right. I want to ask Dr. Barbosa to add comments, if you have any, please. Thank you kindly.
Yes, very, very briefly, Mr. President. Thank you. I think that all member states for your comments. First, I want to apologize for the 6 weeks in advance. I think that we try to achieve this, and I think that this SBPA was a kind of an exception, but no excuses. We need to accomplish with the 6 weeks period, so you can have all the time that you need to review carefully the documents. Just to put a little bit in context, several international organizations are in this process to review their criteria for the candidates. Of course, that the final decision, it's up to the member states. They decide who will be elected. But it was not in PAHO, but in some international organization, the discussion about the candidates with less qualification than department director of that organization. For instance, that they had only a couple of years of work in public health, that he has not probably got all the experience and the knowledge that was needed for the process. So the idea, and Brazil, Canada, the US, Grenada, you provide very meaningful comments to the document, and I think that it can be, of course, improved, because the idea is to facilitate the process for member states to make their decision, and to guarantee that all candidates they are accomplishing with some criteria that are required to be a director of an organization such as PAHO, the Pan American Health Organization. Thank you.
Thank you, Dr. Barbosa. Chair wishes to inform the committee that the discussions would be reflected in the final report. Now we wish to proceed to the next item as per our amended agenda. Item 4.4, amendments to the Pan American Sanitary Bureau staff regulations and staff rules. Therefore, I wish to bring document SPBA 29 to the attention of the subcommittee and invite Mr. George Ballestero, Director of the Department of Human Resources Management of the Pan American Sanitary Bureau, to come to the head table to present on this item. Thank you so much.
Mr. President, distinguished members of the SPBA, Director, colleagues, I appreciate the opportunity to present a summary of the main modifications to the PAHO staff regulations and staff rules of the Pan American Sanitary Bureau. The substantive amendments to the staff regulations and staff rules reflect the recommendations of the International Civil Service Commission and are proposed to maintain uniformity in the conditions of employment of the staff of the Pan American Sanitary Bureau and the agencies of the United Nations Common System. The changes are informed by operational experience, good practices in human resources management, and reinforce accountability, efficiency, and sound stewardship of resources. The amendments are organized into three areas. First, salaries of staff in the professional and higher categories, in accordance with the United Nations System salary scale. Second, changes to strengthen accountability, transparency, and efficiency in the application of the staff rules. And third, editorial changes. Regarding the first point, the United Nations General Assembly accepted the recommendation of the International Civil Service Commission to apply a 1.6 increase to the base salary scale for staff in the professional and higher categories. This was implemented through the standard consolidation method, which consists of increasing the base salary and proportionally reducing the post-adjustment. This approach results in no change to net salaries, in accordance with the principle of no loss, no gain. Regarding the salaries corresponding to the positions of director, deputy director, and assistant director, the same review is required through the standard consolidation method, which likewise results in no change to net salaries. Besides our own standing as an independent international organization, part of the Inter-American system, the Bureau is a member of the United Nations Common System as the regional office of the Americas for the World Health Organization. Therefore, all ICSC recommendations approved by the UN General Assembly must be incorporated into the organization's staff rules and regulations, including the implementation of the salary scale. Accordingly, the Bureau applied these increases effective 1st January 2026. The new salary scale is reflected in Annex C, Appendix 1 of the staff rules. The financial implications related to the increase in base minimum salaries amount to $971,000 per year across the entire United Nations system, and approximately $6,000 per year for PAHO. This amount results from the adjustments to terminal benefits, particularly annual leave. Second, modifications to strengthen transparency and accountability. These amendments reinforce fairness, transparency, and responsible decision-making, while aligning PASB practices with the UN Common System. On this topic, the classification review regarding Rule 230 clarifies that supervisors are the sole initiators of occupied post reclassification requests with a strategic and program-driven approach based on organizational needs rather than at ad hoc individual requests. Abolition post on Rule 1050 refines indemnity provisions to align with the UN system, and the new provision clarifies that staff who have reached eligibility retirement age and are entitled for the pension retirement benefits will not receive the abolition of post indemnity, thereby preventing dual benefits and promoting fiscal responsibility. Third, arbitration for national employees, Norm 920. National employees are individuals hired by PAHO to work in designated country offices or centers under conditions governed by national legislation and labor practices of the country in which they serve. A recent contract review highlighted the need to strengthen the arbitration process. The changes specify that arbitration must be conducted by an impartial, autonomous, and independent body designated by the organization and enhance procedural clarity. Lastly, on modifications proposed to strengthen efficiency. These changes streamline administrative processes and improve operational flexibility without diminishing staff entitlements. I refer to Rule 430 on medical certifications and inoculations. The organization is transitioning from the use of a staff physician for medical examinations to broadening the range of options available to staff. This change will allow staff to use an organization-designated or approved physician for medical examinations, thus granting flexibility for staff and increasing administrative efficiencies and cost saving. On Rule 555, within grade increase based on merit, we're proposing to eliminate an outdated provision allowing for merit-based within-grade increases. This provision has not been applied for several years and creates inconsistencies, as the staff at the top of the salary scale are not eligible to be considered for this merit-based recognition. Its removal allows PAHO's limited resources to be directed toward equitable and transparent performance management processes. On Rule 1083, Notice of Termination, this change permits termination notices to be issued during parental leave, with separation taking effect only after later of the parental leave end date or the notice period. This change enhances operational agility by enabling timely organizational restructuring and responses to financial constraints, while fully safeguarding staff members' parental leave entitlements and benefits. It does not mean that we're separating people while on parental leave. It's just that they can be notified should that be necessary. Selection panels for national employees, Rule N330. The recent contract review mentioned above highlighted the need to streamline and expedite local selection panels for national employee positions. Currently, panels consist of 3 PAHO staff members. The change proposed will allow panels to use one serving national employee as part of the 3-person panel, making this more time efficient. On editorial changes, we are basically proposing to amend and update terminology, correct outdated references, and formalize existing practices without changing substantive rights or obligations. Specifically, the editorial changes correct obsolete cross-references in the Board of Appeal provisions, I refer to Rule 1230, and deleted related cross-references to Rule 555, in within grade increase provisions, Rule 550, if applicable. With this, Mr. Chair, colleagues, and distinguished delegates, I conclude my presentation and remain at your disposal should you have any questions.
Thank you, Mr. Ballestero. The subcommittee is invited to take note of this document and provide any comments it deems pertinent. I will now open the floor to the plenary to begin discussion. The chair recognizes United States.
Thank you. The rules and regulations governing staff are crucial, and we very much appreciate the overall proposed amendments. But we must ensure that PAHO is fit for purpose by maintaining strict fiscal responsibility. That is why we strongly oppose the SPBA recommending salary increases for the director, deputy director, and assistant director to the executive committee. With staff compensation representing the largest share of the organization's budget, we cannot ignore this in our efforts to rationalize the PAHO budget. We recognize the long-standing practice that PAHO staff, including the director, receive pay reflecting those of the UN system, which follows the recommendations of the International Civil Service Commission. This is the core of the problem, and to be clear, our efforts to rein in staffing costs are focused on the entire UN system. Money for extra salaries means less money to improve health throughout the Americas. In addition to objecting to the increase in the salaries, we urge member states to join us in urging the ICSC to deliver significant changes during its 2026 review of the UN Common System compensation and benefits. This is what we expect to see based on last year's General Assembly recommendation that the ICSC bring UN salaries in line with the U.S. Civil Service comparator and rationalize staff allowances and benefits. We urge the Bureau to actively prepare for and implement the outcomes of this review. We invite member states to join us in our efforts to produce increased efficiency and effectiveness for PAHO and other international organizations more broadly. In the meantime, we can do what is in our power here and prevent an unnecessary jump in costs in PAHO by not increasing salaries for the director, the deputy director, or assistant directors. This will help us demonstrate real efforts in producing increased efficiency and effectiveness for the organization. To be clear, if the SPBA proceeds to recommend such increases, the United States will actively oppose them in the Executive Committee and Directing Council. Thank you.
Thank you, United States. Your comments have been received. We now ask I recognize Argentina. Yeah. Okay.
Thank you, Mr. President. The issue of salaries and the salary adjustment for people working in any organization today is an extremely delicate issue when it comes to making adjustments, generally upward. This is a reality, something well known by my country, as these situations have resulted in us today having major differences between salaries for officials and salaries for the staff, and even among personnel themselves. These situations that seem a little bit pointless or that maybe don't have a significant impact in the longer term, and my country is well aware of this, end up by having a major impact, not only the net take-home salary, but also in trust. Without having absolute clarity as to which would be the best way forward, and again, based on experience as to what's happening in my own country, the request from Argentina is for this situation to be handled with as much common sense as possible, with the greatest care, and being very cautious to protect those who are being represented. Basically, it's not merely because of an economic and financial issue, but one of trust. Thank you very much, Mr. President.
We receive your comments, Argentina. and I do not see any other indications. Therefore, I would ask Mr. Ballesteros to respond to both comments.
Thank you, Mr. President, and I thank the delegations of the United States and Argentina for their comments. We welcome your guidance, and we appreciate the importance of not only being virtuous, but appearing to be. I might have not been clear enough. This is a no-cost, no loss, no gain increase. So the proposed increase is a 1.6% to the base salary. But at the same time, it's a 1.6 decrease on the post-adjustment. So there is no increase in the salary. However, precisely, and this is in response to the distinguished delegate of the US, precisely because of the comparators and the respect that we're having on the process, the ICSC has to do the review on the regular basis. And the findings that they make imply that a 1.6% would have been warranted. However, because of this process, this principle of no loss, no gain, the way to balance it out is you increase it at the salary base, decrease it at the post-adjustment. Now, does this have no financial impact? No, it does. Very little, which for PAHO is $6,000. When will this be materialized? When somebody, not only the deputy director or assistant director, when somebody retires or separates from the organization. So then those would be that would be the financial impact. Respondiéndole a la distinguida delegada de Argentina.
To respond to the distinguished delegate of Argentina, yes, indeed. Part of what we have done under Dr. Barbosa's leadership is what in Costa Rica we say is to follow the trend. And this means not only what I have just explained about the no loss, no gain, but in addition, we are being extremely conservative in managing vacancies. Salaries, therefore, are tied to the International Civil Servants Commission methodology and approved by the General Assembly. And then we have to manage the vacant positions, guaranteeing that we can provide you with the results you're demanding of us, but also do it within the approved budget. Thank you very much, Mr. President.
Thank you, Mr. Ballesteros, for your adding clarity to this situation. And now invite Dr. Barbosa to add comments. Thank you.
Thank you, Mr. President. I really appreciate the interventions asking us and supporting us to be very prudent in the financial management of the organization. We have been doing that. Last year, by the end of the year, I made a tough decision to close 220 positions, 180 field positions, exactly to adapt the financial situation of the organization and the guaranteeing that the organization is fit to provide all the technical cooperation that our member states require. In the current case, I think that I think that Mr. Ballesteros has already explained there is no real increase, but we need to adapt it to the recommendation from the UN system, so it will be an increase in a part of the salary and a reduction in the other one, so the salary will be the same. I don't know, the ones that are not familiar, we have in the UN system two parts of the salary, one of the basic salary and the post-adjustment that is different in New York or in Washington or in Buenos Aires or in Lima or in Brasilia, because this is related to the cost of life at this particular city. So the increase will be in the basic salary, and the other part will be reduced at the same amount. So it will be I don't know, fortunately or unfortunately, but I will not receive 1 cent of increase. But just in this particular case, but I fully agree that the criteria that the UN has used to review and to propose salary policies. I think that is a very important and complex issue. I understand that the member states of PAHO, of the UN system, needed to participate in this discussion because we need to, of course, to have salaries that can attract the talents that we need, but at the same time, we cannot have any kind of salaries or payments or benefits that will be different from the civil servants in the country that we are. So I think that is really a very important point that was raised by Argentina, by the US. I think that it's not a discussion only for PAHO, but for the entire UN system that I really think that is important, not only due to the financial situation that all the multilateral organizations, international organizations have now, but to provide a better and a fair distribution of the use of the resources that the member states put in these organizations. Thank you, Mr. President.
Thank you, Ms. Dr. Barbosa, for your comments and for added clarity. I think, yeah, I notice the United States, so I give the floor to the US. Thank you.
Thank you, Mr. President. And we very much appreciate the clarification and understand the basics and the of what's happening with the salaries. But I think at this point in time, if we could ask to leave this issue open for further discussion, that would be greatly appreciated. Have a chance to talk over with other member states some of the issues that we were bringing up, that we were raising, if possible.
Thank you. Right. Thank you so much. We appreciate your additional comments. So all comments raised on this matter will be indeed reflected in the final report and will be forwarded to the Executive Committee for further consideration. We believe all the comments are in fact valid and will be considered. I now wish to So I now wish to refer us to agenda item number 4.5. This one treats with the human resource management in the Pan-American Sanitary Bureau. I refer the subcommittee to document SPBA 2010 to the attention of the And I now invite Dr. George Ballestero, Director of Department of Human Resource, who is already here, to continue on this particular document. Thank you.
Thank you, Mr. President. Distinguished delegates, director, and colleagues. Permítame empezar disculpando.
Let me begin by apologizing towards the distinguished delegate of Ecuador. The presentation I have is eloquent in colors.
This report presents three main points on PAHO's people management in 2025 and how we maintain results despite increasing demands and, as you know, limited resources. The first message I would like to convey refers to the people strategy. The people strategy is our blueprint for people management during the next 5 years. In 2025, the Bureau launched this strategy to strengthen how we attract, support, and develop our workforce. it places accountability, leadership, and skills at the center, because we know that sustained results depend on our people. Under the theme, Transforming Talent, Advancing Health, the strategy envisages a workforce that is highly competent, engaged and empowered, and productive and agile. It introduces a workforce life cycle framework that links workforce planning, recruitment, development, and performance management directly to PAHO's mission and priorities. 5 strategic areas of work have been identified. First, strategic workforce and structural planning. Strategic workforce and structural planning are essential for ensuring PAHO has the right skills in the right places and at the right time. This approach enables the organization to remain fit for purpose, something that has been highlighted by one delegation previously, aligning its resources and capabilities with its mission and objectives. Targeted recruitment efforts in 2025, along with the recent strategic planning process, serve as clear examples on how theory is being translated into practice. By focusing on securing the appropriate skill sets where and when they are needed most, PAHO demonstrates its commitment to effective people management and operational excellence. Second, talent attraction, acquisition and onboarding. To strengthen our talent pipeline and employer brand to be fit for the future, PAHO is focusing on 3 main actions: boosting employer visibility with proactive engagement on professional social media to attract top talent, digital recruitment, by this I mean fully online processes, leveraging digital modernization and client orientation to increase efficiency and stakeholders' experience. And third, enhanced onboarding. We are updating our induction programs to support both internal transitions and new hires. Third, performance and talent development. Prioritizing the practical acquisition of skills over traditional training methods and emphasizing accountability for delivering high-quality results. This approach is designed to ensure that the organization remain fit for results. The third element I have is the performance and talent development. Sorry, that I read already. I want to highlight that on the issue of performance and talent development, we are investing in learning platforms, which have proven to be the most cost-effective mechanism to enable all our workforce, regardless of their contract, access to over 26,000 courses on a diverse range of relevant subjects. To these platforms, I refer to LinkedIn Learning, Blue Line, which is the UN Staff College, iLearn, and PMIS, which is our independent platform. Additionally, we are promoting effective feedback, fostering an environment of respectful, caring, and candid feedback to encourage excellence and measurable impact. Fourth, leadership and accountability. To reinforce effective management and trust, the organization has implemented tailored support and capacity building measures. Leadership and management certificate programs concentrated on communication, people management, and accountability have been delivered to 26 mid and senior level managers, and in partnership with the Office of the Ombudsman, 97 managers gained practical tools to approach difficult conversations, feedback, and conflict resolutions with confidence and skill. Lastly, fifth, organizational culture. Fostering an engaged, inclusive, respectful, and healthy workplace through initiatives such as organization-wide campaigns promoting respectful workplace and uphold a policy of zero tolerance, reinforcing shared values, training programs and targeted interventions, and maintaining a clear and consistent approach to addressing misbehavior that we will discuss a bit later. These 2 last measures combined are designed to ensure that we deliver results effectively and pursue growth together as one. It is also important to note that strategy has links to our 2026 and 2027 planning cycle, using scenario analysis to prioritize actions and align program budgets with human resources planning. The second message, Mr. President and the colleagues and the distinguished delegates, is delivering results. Despite financial pressures and uncertainty, The Bureau sustained technical cooperation through prioritization, flexibility, and the dedication of our excellent workforce. Following a hiring freeze, fixed-term selection processes declined from 115 in 2024 to 54 in 25, and short-term selections fell from 73 to 44. Targeted recruitment, as I mentioned before, ensured covering critical functions and business continuity, including 38 international technical professionals and 9 technical national offices. We also invested in preparing future talent through our internship program. We engaged 64 interns from 23 countries, mostly from the region and women, and selected from a pool of almost 1,500 applicants. On staffing and statistics, Mr. Chair, the report shows that staff positions have been stable over the past decade, even decreasing slightly, and by this I mean 2%, from 855 staff in 2015 to 839 10 years later in 2025. Consultants were hired to provide specific expertise or added support as needed, including for emergencies. However, their number also decreased in 2025, and this reflects prudent and responsible workforce management. Our personal distribution by sex has also been stable, with women representing 60% of our workforce, similar to 2024. Among professional staff, we maintained parity. It is important to note that for us, merit-based recruitment is the basis for our recruitment. Therefore, we continue to apply that as our guiding principle. Mr. President, the third and last message I would like to share reflects how we deliver. The report reaffirms that PAHO is committed not only to achieving results, but to doing so with integrity, respect, and accountability. Our methods matter as much as our outcomes. In 2025, PAHO advanced its mental health and well-being work plan, aligned with the United Nations Mental Health Strategy. This included promoting the Employee Assistance Program, providing counseling, group and individual support, building resilience, and offering help after critical incidents. In support of a respectful work environment, the organization continued strengthening its culture of respect, integrity, and accountability. In coordination with the Offices of the Ombudsman and Ethics, respectful workplace learning platforms and activities were leveraged to reinforce shared values, expected behaviors, and mutual respect. At the same time, the organization advanced efforts to prevent sexual misconduct through the continued implementation of its zero-tolerance policy, promoting awareness, reinforcing accountability, and strengthening trust among personnel. PAHO's zero tolerance on misconduct is not just a policy, it's a practice. From January to 15 December 2025, after thorough investigations and respecting due process, 6 administrative disciplinary decisions were issued, ranging from dismissal and separation to restricted access to our premises. Other cases remain under review with possible action during this year. Mr. President, distinguished delegates, we believe the report contains 3 main messages that should demonstrate that in 2025, PAHO advanced its people and management practice, achieved outcomes despite financial challenges, and maintained strong leadership and core values. Thank you for your support, and I welcome your feedback and guidance.
Thank you so much, Dr. Ballesteros, for that report. I now invite the subcommittee to make your interventions. Thank you. The chair recognizes Brazil.
Thank you, Mr. President. Brazil would like to express thanks for the presentation of this report on the human resource management at the Pan American Bureau, we reiterate our conviction that the staff of the organization is its greatest asset. We'd like to express our acknowledgement of all of the PAHO professionals for the essential work that they carry out in the headquarters as well as country offices throughout the region, oftentimes in very challenging contexts and with strapped budgets. Brazil commends the launch of the People Strategy 3.0, which represents an important evolution in the approach to personnel management. We welcome the adoption of an integrated perspective of the life cycle of the workforce geared toward results. We take note of the financial restrictions that have had an impact on planning of the workforce for the 2026-2027 biennium, including the reduction of positions. And to this effect, we appreciate the efforts put forward by the organization to carry out this process based on transparent criteria, strategic planning, and support measures for those affected staff members. We would like to know how the Bureau intends to mitigate the possible impact of these cutbacks on technical capacity as well as cooperation efforts made available to member states. And furthermore, we would like to know how the implementation of the Shared Services Center and its implementation might evolve in the future, including the possible geographic distribution of some of the additional functions. Brazil recognizes the progress made by way of modernizing the recruitment processes, especially with the introduction of the new PMIS module, which will bring greater efficiency and transparency. At the same time, we observe that the number of selective processes was sharply reduced as a result of the hiring freeze. And on that, we would like to know which measures are being considered to ensure the renewal of talent and to avoid critical capacity gaps. Now, as regards the institutional culture, Brazil appreciates the strengthening of the zero-tolerance policy for dealing with undue improper conduct and treating such conduct with transparency. We would like to stress the update of the report mechanism and the broadening of the scope of the conducts brought under that category, as well as concrete measures that have been confirmed. We also recognize the progress made in gender parity, including keeping up levels above parity for certain professionals, and we encourage that the organization will continue moving forward in keeping with the highest levels of leadership. Thank you very much.
Well done, Brazil. Thank you so much. The chair recognizes Ecuador.
Muchas gracias, señor presidente.
Thank you, Chairman. President, the delegation of Ecuador would like to express thanks for the presentation of this human resource management document and the appropriate management of human talent, which is a key element to ensure greater efficacy of and compliance with the technical work done here by the organization. And so the implementation of the 3.0 People Strategy is an initiative that's geared toward planning the labor force to achieve talent procurement and to spur further training and for there to be an inclusive and accountable internal policy on staff. Now, we call for the continuing of those operations within a financial context that's very complex. We understand how hard that is. I would also like to add, as a prior consultant to PAHO, the importance of there being continuity in these processes and what we do in each one of the technical offices also is rooted in a transfer of knowledge that can be done with the health ministries in each one of our countries, thereby strengthening staff at the local level, as well as the transfer of knowledge and capacity from the central offices to the outlying offices in the field as a means of ensuring that there be a good transfer of knowledge and to keep up the results that we've achieved thus far. And to do so, we're going to have to tighten our belt, as was said. Those actions geared toward enhancing HR management processes is something else we see as a means of promoting institutional leadership that's quite positive in the overall well-being of the staff. The investment, as I was saying, is key to develop capacities through the different methodologies and mixed methodologies on an ongoing basis. And also, this is a key factor to ensure a resilient organization that is prepared to respond to the challenges that our region faces. It's also very important for us to continue to bolster the strategic planning mechanisms for personnel to optimize the use of available resources in each one of our countries and to ensure the financial sustainability of the organization by making sure at the same time there be compliance or fulfillment of mandates. On that, we offer support to that which is called for in this document, taking note of the report that was submitted to the subcommittee. Thank you.
Well done, Ecuador. Thank you so much for that contribution. The chair now recognizes Canada. You have the floor.
Thank you, Mr. President. Canada thanks the Secretariat for this report and extends its appreciation to all PASB staff and personnel for their continued commitment to the organization's work. We are pleased to see the launch of People Strategy 3.0 and its new Workforce Lifecycle Framework. Canada commends PAHO's efforts to advance a people-centered approach to HR management that reflects the full staff experience with the organization. We acknowledge that the 2026-27 HR planning cycle unfolded in a challenging context, and we welcome PAHO's evidence-based decision-making approach focused on prioritization and the optimized use of limited resources while safeguarding core functions. We also recognize the direct impact on staff. An organization's strength lies in its people, and we appreciate that efforts are being made to support staff through transition in coordination with the Staff Association and in line with staff rules. Echoing statements from other colleagues, we welcome continued updates from the Secretariat on the HR situation and the implications and challenges on the organization's overall capacity and operations, both at HQ and in country offices. Thank you.
Well done. Thank you so much, Canada. The chair now recognizes Argentina. Thank you.
Thank you, Mr. President. Argentina is grateful for and takes note of the report, and we agree that staff is the best asset of this organization in order to carry out the plans of action and strategies in keeping with the strategic plan throughout the Americas. We support the whole strategy for personnel, which promotes a competent workforce that is nimble to respond to the evolving priorities within health. From that standpoint, we think it's necessary for us to make use of tools for planning, for procurement, hiring, as well as and performance measuring in keeping with the strategic goals of this organization. We also think it's necessary to prioritize, foster, and to promote that those positions, fixed as well as short-term or consultancies, be held by people of the region throughout the Americas. We take note, and we're pleased to see that the office has adopted the administrative measures, the appropriate disciplinary measures in case of improper acts, and there should be the continuing of the zero tolerance policy. It's important to see that a percentage of those who are hired for fixed terms at an international range also include professionals from our region. Thank you.
Well done, Argentina. Thank you so much. We appreciate your interventions. We now recognize, the chair recognizes Panama. So Panama, you now have the floor.
Thank you, Mr. President. Panama recognizes the progress made in HR management of the Pan American Sanitary Bureau, underscoring the efforts made geared towards strengthening the planning of human talent to enhance the selection processes and to promote professional development of staff. Within this context, we think it's timely that we continue to consolidate strategic management of HR, contributing thereby directly to the achievement of the institutional goals, particularly It suggested that we strengthen the strategic planning of human talent, ensuring that it be aligned with programmatic priorities and the emerging challenges in public health throughout the region, to delve deeper into competency management, ongoing training of staff, and bringing that into line with the needs of the institution, to strengthen the performance assessment mechanisms, tying them more directly to the programmatic results and accountability, and to drive policies of diversity, inclusion, and equity, making sure there be regional representation as well as equal opportunities, to strengthen retaining staff and the well-being of staff, promoting healthy and sustainable working environments, to make use of digital transformation tools, to optimize the HR management processes and decision-making based on evidence. In conclusion, we think that management of HR is a key pillar to strengthen this institution, which is why it's so key for us to continue working toward a strategic model that's efficient and aimed at results, consolidating the leadership of the Pan American Health Organization in the region.
Well done, Panama. Thank you so much. We now invite the United States to make your intervention.
Thank you, Mr. President. Thank you for the opportunity to discuss this item, and as we know, staff are core to every organization's work. The United States will not support unlawful DEI-related practices or divisive gender ideology language, policies, or programs. As such, this and future HR reports must be fixed by replacing the word gender with sex. We support building an engaged and healthy workforce, but we must insist that the word inclusive be removed because these decisions should be based on merit and not other factors. We also find it problematic that the PASB Mental Health and Wellbeing Work Plan aligns itself with the UN Workplace Mental Health Strategy, which also promotes unlawful DEI policies. Moving to other items from the report, PAHO needs to continually find cost savings and efficiencies, and the 17% reduction in staff positions demonstrates concrete progress on that front. The Shared Service Hub is another step in the right direction to find further ways to cut costs through consolidating certain services at a lower cost location. Finally, we appreciate the Bureau's specific reporting on actions taken in all 6 cases of confirmed wrongdoing involving Bureau personnel. Timeliness and transparency on addressing and reporting wrongdoing is absolutely critical for the future health and credibility of the organization, and this level of detail we expect about consequences for wrongdoing. Having said that, of course we want to see less wrongdoing overall, not just reactions to confirmed cases. So we call on PAHO to redouble its efforts to prevent any incident of attempted financial misconduct or interpersonal wrongdoing, especially sexual harassment. Thank you, Mr. President.
Thank you, United States, for your intervention. Much appreciated. I believe this now brings us to the end of our interventions from various parties, representatives. I will therefore call on Dr. Ballesteros to respond to these interventions. Dr. Ballesteros.
Thank you, Mr. President. Let me start by saying thank you. You know, it's become a commonplace to say that people are the core and the most important asset of the organization. But I think we should never get tired of saying it. You see, our people are hearing us. And as some of you said, several of our people are working in direct circumstances, in very challenging contexts. And your words matter. So the first thing I have to say is thank you. We hear you and we welcome that support. Second, it is quite encouraging that all member states that have taken the floor have detailed observations on the impact of our new approach. We're advancing, building on what we have developed in the past to have a people-centric approach in people management. So we're moving from transactions, which is human resources management, to people management, and that is critical. Let me address concrete elements that you have raised very briefly. Eu não falo português, so perdão.
I don't speak Portuguese, so I apologize for my mixture of Portuguese and Spanish portuñol. So the question that I understood was, what is PAHO doing to ensure that, given this, the straits we face, that we keep up our capacity? The freezing of the vacancies happened in 2025, and as I explained in the report, that was done strategically. Rather, they were lifted strategically to ensure results. At the end of 2025, the strategic planning of this biennium through 27, and we did our prioritization based on the expected budget. So instead of just reacting to a budgetary cut, we prepared ourselves strategically, and the focus of the strategic plan enabled us for managers from the field to tell us what the priorities were, priority 1, 2, 3, and so forth, and based on that, we structured our labor force. As regards measures to renew talent, I would invite you to visit us and follow us on our social media. We have used social media to attract talent, in addition to those vacancies we are prioritizing. Now, Ecuador, thanks for your support. Now, knowledge transfer is important to us. We do take note of your experience. PAHO has a staff, consultants, a whole host of contracts which enable us in each country to meet needs and to ensure knowledge transfer. As a prior consultant, so you're very much aware of that, and I thank you for your support. Canada.
People-centered approach, evidence-based, and prioritization, and the strength are links to people. You also mentioned how we are coordinating with Staff Association and others. And let me reassure you, we have a close partnership with our Staff Association. We're also taking action to mitigate the negative impact of the decisions that have been made. We have colleagues that are losing their jobs. These actions include, we hired a company for outplacement. We have our mental health colleague helping them. And as I mentioned in the report, we have the Employment Assistance Program that provides support. Argentina.
I'm on the verge of our trading seats because you pretty much said everything that we are doing, we plan to do, and I thank you very much for that. We do want to prioritize staff of the region because we want to draw from the talent that we have, and also regarding tolerance, or intolerance rather, zero tolerance, so we have our priorities. We want to make sure that our people be nimble and competent, and we have upgraded all the tools for planning that we have on our platform, Panama. In addition to thanking you, reiterate to you that we are making efforts because PAHO is the only organization that has its labor force tied to outcomes. We have labor force, outputs, and outcomes. And you're right in saying that we are still working on that. It's not easy to link performance evaluation to output and outcome.
We take note of all your points. We are very clear on the need to be merit-based. Inclusive for us is translated into making sure that people like me, I'm quite short-sighted, so I need to have very big funds. Or like our distinguished colleague and delegate from Ecuador that has the color blindness. That's the main emphasis. We want to make sure that we include everyone in PAHO, that regardless of creed, sexual orientation, anything that is, we are a family and we welcome everyone to feel welcomed. That's what I have to say. Thank you very much again for your support.
All right, thank you for your answers to these questions and observations. Dr. Ballesteros, thank you so much. And I now invite Dr. Barbosa to make comments. Thank you.
Thank you, Mr. President. Thank you. I want to thank all member states for their very kind words recognizing how important is the staff of this organization and the very important role that they have implemented during dramatic times like the pandemic, but also in the day-to-day tasks that they perform, improving the public health agenda and well-being in all the countries in this region. Let me make some general comments because I think that all the questions, specific questions, are already well responded by Mr. Ballesteros. But just to call your attention to that graph that we present, the trends on the human resources in PAHO. Because sometimes people are saying that all the international organizations need to reduce 20% of their workforce. If our organization increased 100% their workforce in the last 10 years, and I will not name any organization, but this is we have several real cases of this behavior. When you are asking them to reduce 20%, they are still having almost 8% of increase compared to the start point. For PAHO, that is a very lean organization. When we compare with the number of countries that we serve, the number of country offices that we have, we are a lean organization. And even being a lean organization, we are almost at the same level that we were 10 years ago. We increased the number when we needed to provide more support to the countries during the pandemic or during a public health emergency, or when we mobilize resources from voluntary contributions that request us to increase temporarily the workforce to implement that project. But these are temporary contracts. So for this reason that it's important to review carefully the numbers, the figures that every organization presents in order not to punish who was prudent. So I think that I want to call your attention. I prepare some figures comparing PAHO related to the number of countries, number of country offices, the regional office. You really can see, based on figures that and numbers, that we are a lean organization. Second, let me switch to Spanish. Sorry, Brazil, but I will make a comment about your comment, but I will not make it in Portuguese in order to be more. I think that the other countries also can understand.
This is a very important point regarding the mechanism that we're using. Now, with the cutback in positions, what we are seeking to do, in addition to reducing posts that were not directly related to the essential mandates of the organization, we also seek to carry out changes in our processes, making the organization more effective. By way of example, during the review process, and I went one by one through all of the proposals for the HR plan for the biennium with the changes in the artificial intelligence, automation, all these different processes of the new platforms and so forth. And some of the departments, they said, look, I have 3 positions which are more operational. I could conclude 3 of those operational ones if I receive one strategic one that is more capable of carrying out analysis that would be more helpful, useful for our needs now. So many of the positions that we closed were positions of that type or seeking that double criterion. Actions and functions that are no longer a part of the essential missions because the member states or that the member states have approved over the last years, because the fact that the situation has changed a lot, and it changed as a result of the work we've done to strengthen our the capacities that countries have. So I always say to our staff, PAHO doesn't exist to support countries to do the same thing that they did 5 years ago. PAHO is here to spur countries to do better, to be more efficient, to incorporate new strategies more quickly so that they can move forward more swiftly, bringing about those necessary changes. So that, on the one hand, that was our rationale. Now, for those critical, essential positions that are still vacant, we are going to be very careful, prudent in opening up the selection process, not all of the vacancies at once, but starting with a small number of positions which were part of that trade-off I described. If you give me a position that's more strategic, then I can close 2 or 3 operational positions which aren't as necessary as they were in the past. Now, the shared service hub, without a doubt, I do think that's necessary, and we've made a lot of headway with that process. You've received a specific report on that subject matter, and what we're concerned about there, what we seek to do, is not just change the same number of positions that we have today in Washington, switch them out for the same number in other countries, but rather to avail ourselves of this moment in the whole review process that we did with the work processes, is to re-examine the processes themselves. If we're doing something the same way we did 20 or 10 years ago, and today we have the opportunity to do it more efficiently with cost reduction, then that's what we're going to do.
Lastly, I completely agree that the zero tolerance policy when it comes to inappropriate procedures, fraud, or harassment, in the organization we seek to work both on prevention, as clearly pointed out by the US delegate. We don't merely have to wait for something to happen and then work on it, but work on prevention. We recently had an internal campaign in the organization providing clear examples of which situations must be considered. For instance, if it's a problem of interpersonal relationship, for instance, I didn't like how my colleague addressed me at a meeting. Well, that is not a topic that requires an investigation, but it could be a topic where the ombudsman or a counselor could seek to improve interpersonal relationships. On the other hand, conflicts of interest and potential conflicts must be seen in all cases and must look at by the ethics office to see if there's a conflict of interest. And if there is perception of fraud or harassment of any kind whatsoever, then an investigation must be requested immediately. So there is this process as, on the one hand, awareness, and last year an external consultant actually conducted an evaluation of the ethics office and the investigation office in order to have terms of reference that were better adapted and that there was no overlapping that would result in a staff being uncertain and miss out on an opportunity to report something. So I do think we're on the right path, and you will be hearing about this at the Executive Committee. There have been more complaints, and perhaps more complaints because people now feel more confident in the channels where they can present their complaints. We also seek to reduce the investigation time so that the investigation ensures rights of all people. Investigation, after all, is not a sanction or punishment, but it seeks to clarify facts of what actually happened. But also we want to have investigations conducted in a reasonable amount of time so that the victims or that the misdemeanor or the fact that has been identified is not lost over an excessive duration for the investigation. So I do feel very much in agreement with your comments, and I agree that the organization, even with all efforts for prevention, the organization nonetheless needs to be ready to conduct the appropriate investigation and to adopt the measures that are necessary and to do so in good time. Thank you, Mr. President.
Thank you so much, Dr. Barbosa. Well explained. We appreciate it. And this has brought us to the end of this section. And we want to now propose that we take a short break and be back here for 1600 hours so that we can consider PAHO's forward. Exactly after the break, we will be back here. That's 4 p.m. To look at PAHO's forward. Thank you.
Okay, good afternoon. Now we have a briefing session. The Secretariat will provide an update on PAHO Forward initiative. PAHO Forward was launched in 2023 as an initiative to increase the efficiency, transparency, and accountability in the organization. So the first round of proposals, I think that Monica Davoli, that is the Chief of Staff, will provided some very important achievements. After the first wave, we had the second wave, and the second wave was a very interesting one because we opened the contribution for the staff, and not only individual contribution, but also some departments or country offices or unities, they get together and they think how we can improve the things, how we can be more efficient, how we can reduce the unnecessary bureaucracy in order to provide a better use for the resources of the organization. So now we are in the third wave of the PAHO Forward, and we are very pleased to share with you, and of course to receive some suggestions, contributions, things that will allow us to improve the process. So Monica, please, you have the floor.
Thank you, Dr. Barbosa, and good afternoon for everybody that is accompanying us still. So I have the pleasure to brief you on where we are with the PAHO Forward initiative. As Dr. Barbosa mentioned, this is an initiative that focuses on promoting continuous modernization of our internal systems and process. I'll give you a brief on what the purpose is and the framework that we work on. PAHO Forward focus on promoting continuous modernization of PAHO's management practice. It proposes to do this through strengthening efficiency, which you can understand as streamlining the processes and reducing the costs to maximize the resources available for health programs. We do this towards enhancing transparency, which can be translated by providing clear and comprehensive information to stakeholders about the organization's activities, policies, and practice. And we do this through ensuring accountability. In other words, clear responsibility for results and continuous improvement. The framework the initiative has an internal governance structure and an accountability structure. The governance structure is around its method is an operational group that meets regularly. It has the responsibility to ensure that each annual work plan, as Dr. Barbosa said, we are on the third year, so we are on the third annual work plan. The work plans are developed, and the initiatives included there have the support of the whole organization to be implemented. You have on the screen the composition of that operational group, and the operational group reports to executive management on a regular basis. And we also get guidance from executive management in terms of the actions that are lagging behind, how we can push them, what are the issues we need to address to make sure that all the actions in the work plan are implemented. Before we go to where we are now, allow me to share with you some of the achievements and some of that we are proud of, that we managed in the first 2 years of this initiative. So it has a movement apparently. Here we go. So I'll mention, I won't go through all of them. I'm sorry for the small letters, but as you can imagine, we have a lot. One of the things we're very proud of is the increased delegation of authority to country offices.
That was done right in the beginning of the plan of action of PAHO Forward. This has resulted in us reducing time for processing contracts, purchases, and payments. And this came it was combined with an increase in 30% in the numbers of internal audits. So we not just delegated more, but the counterbalance for that was to increase the number of internal audits performed. And we didn't stop there. Besides performing more internal audits, we are also make the internal audits report in its integra from page 1 to page end of the page, available to member states. Right now, we stand at 33 internal audit reports available to you in case you would like to have access to those. We have changed the policy to allow for the publication of independent corporate evaluations. Our previous policy did not allow for that. So again, in terms of gaining transparency, we are now publishing the full reports of the independent corporate evaluations. As we stand now, we have published 5 corporate evaluations. We have automized the charges for contracts, which is a very technical language. So that means that it allowed, by automation of some of the charges on the contracts of staff, we have improved budget monitoring and reducing manual transactions. And we have launched the Regional Revolving Fund portal. And for those countries that are recurrent users of our revolving funds, you probably have noticed that that portal allows for continuous update of information on balances and outstanding invoices, facilitating member states' monitoring of orders, of purchase orders, and PAHO's monitoring of reimbursement for purchase through those funds. Then we have the office, the PAHO has prioritized the development of our country cooperation strategies, which is an agreement between the countries and PAHO on what are the priorities for technical cooperation in those countries. In the first year, we've done 9. The count at this point is 29 country cooperation strategies signed, developed and signed, and 3 sub-regional cooperation strategies. It's the first time PAHO has gone as far as negotiating and signing cooperation strategies with the sub-regional entities. We have an increased number of partners seeking to partner with PAHO and formalize that partnerships. In 2025, we have 37 non-state actors in official relations with the organization, which is an increase from 27 when we started. And you have, all of your countries very likely have experts serving in one of the 12 strategic advisory groups launched by the organization 3 years ago, in which those groups gather around specific public health issues and provide the director of PAHO with recommendations that are science-based and based on sound evidence. In the first year, still, we have also worked on some internal human resources issues. You've heard my colleague, the Director of Human Resources, before. We have established key performance indicators for selection processes, for the recruitment of staff. And with that measure and monitoring those indicators, we have managed to reduce by 30 days the selection process from 183 days to 153 days. We're still short of our target. 150 days is our target, but the entities are committed to work towards that goal. We have also revamped our internship program. You've heard again before about that. I would like just to repeat what were the changes, and the changes were mainly to bring transparency to the process. Now we have 2 calls for interns that run from February to June and from August to September. Any young professional from the region can apply. And we have also adjusted the relation with the intern, and PAHO now offers a small stipend to the interns. And we think that measure allows for interns not only from more affluent families or communities, but also from all the countries in the region. And we have, in the first year, revamped, adjusted, modernized our performance planning and evaluation system. That is the system we use for the individual evaluation at the end of each year, if the staff has fulfilled or achieved its work objectives. So we have worked on simplifying, but also making that evaluation process more focus on the individual contribution towards the objectives of the organization. That was the first year. We had, these are some of the actions that we implemented. We had 80% of the expected results achieved. Year 2, and that's the one that Dr. Barbosa mentioned, that we had 124 suggestions. So the staff was really engaged in providing their feedback in terms of what we could do better. And some of what we've achieved on year 2, the first item is the shared service initiative that was launched. I will not go into that since you will have a full briefing from the person responsible for that himself tomorrow. But a second item I would like to mention is the update on the internal policy of the organization, internal control policy, ensuring that the segregation of functions are incorporated in the system, and the application of the 3 lines of defense is consistent. We have improved liquidity management and the adoption of foreign exchange competition. And those 2 measures alone have generated an estimate extra resources, extra gains of about $7 million in the biennium 24 and 25. So it's another example of how we are in modernizing our practice. We have found space to gain efficiency. Another achievement was the improved automation by incorporating the use of AI tools to support procurement processes. The unit of procurement, you have seen the level of procurement they do annually with the financial report. It's almost $1 billion. So they have been very proactive in incorporating AI tools for drafting terms of reference, gathering provider information, drafting correspondence, and preparing requests for proposals. Besides those modernizations, the procurement program has also established key performance indicators for their internal process, which will allow for other modernizations. And among the achievements, we have adopted standard templates for publications. PAHO publishes about 200 publications per year, and with standardizing the templates, we have managed to reduce the costs of each publication in between $5,000 and $8,000. So that's significant as well. Further, we have expanded our partnership base. PAHO has, within this second year and the third year, so let's say since 2024, we have formalized 24 new financial agreements with partners and 27 agreements with non-financial institutions. These alliances enhance PAHO's ability to support the countries, many involving innovative ways to do things. There is a drone to deliver drugs in Panama. There is an app in Peru to increase immunization. So these are some of the innovations that those agreements allow us to test. Our social media account has reached 2.5 million followers, expanding the reach of PAHO's scientific-based public health policies. We have strengthened the project development and implementation process and streamlined internal collaboration groups. For you to have an idea, this organization is in the process of. We have 48 internal collaboration groups, and many of them, the same people were members, or the membership was the same for the last 10 years. So we produced a new policy about that. We established benchmarks and requirements for each collaboration group with term limit for the members, etc. So that is ongoing in terms of and we hope to reduce the internal collaboration groups with that new policy. We have improved resource-based management by implementing the recommendations of the 2024 external evaluation. And still on the second year of implementation, we have launched a HR chat box, which is again an automated use of AI mechanism to respond to staff queries. That has alleviated the time of staff in the human resources entity and has allowed all the 2,400 staff, roughly, of PAHO to have a quicker response to their queries. We have launched a senior expertise recognition program, and that is a program to value staff explicitly, mainly those that have been with the organization for a long time and have acknowledge, recognize expertise that are references for the region. At this point, we have 39 staff that have been recognized with the program. And we have signed an agreement with the UN volunteers that introduces a new space, a new opportunity for acquiring pre-qualified staff and attract them to PAHO. There has been also the establishment of key performance indicators for investigations. Dr. Barbosa has made a reference to that. The goal is for those to be timely, the response to be timely. We have also launched a campaign at the same time to promote the reporting and utilization of the mechanisms for the system of justice of the organization. Finally, there are a few other things. The establishment of the use of lump sum for statutory travel. It means that when you are appointed or when you have to return home, we are now using a lump sum. So it allows us to be more expedite in processing those requests. Now, 86% of the expected results were achieved in year 2, and we are now in year 3. Some of what you see here are not just on course, but also already implemented. So we are very proud of that. The first thing is the launch of the AI Innovation Lab. That is an internal space for us to test AI and its functions before we launch for the use of the organization, both for providing technical cooperation, but also for doing our internal work. We have implemented AI agents in support of the procurement functions, launched the PAHO 3.0 people strategy that you heard about it, established a PAHO editorial board, developed a budget portal. That portal gives you live updates of the implementation of our program and budgets. You can visit to see the historical data for the last 3 bienniums, but also how we are doing in the current biennium. And we have a new case management system for investigations. You see that some of the issues are an evolution of where we first started. No, as you improve something, you see that you can do more and you can go further. And that's exactly the spirit of PAHO Forward, that continuous improvement. So the case management is the adoption of a new case management system for investigation responds to that. Instead of monitoring the cases through an Excel sheet, we have now a system that tracks them through all the steps of the process. In terms of transparency, we are working on defining criteria for reassignment of international staff. We have staff throughout the whole region, and it is important to ensure that that transition from one country to the other is done in a planned and transparent way. We are working on the standardization of cost calculations for the recovery, for our recovery framework. That has to do with our voluntary contributions agreements. We want to make sure that the resources you put as assessed contributions are not financing earmark specific projects. So to be able to allow us to go into a very refined way, to go further into making sure that that is well calculated, we are developing a tool so everybody in the organization use the same tool and standards. We're developing the job architecture. It has to do with the definition of the different positions, the grading, the requirements, etc. So again, it's to standardize and facilitate selection, transfer, reassignment, etc. We are from this year on going to go further with the corporate evaluations and publish not just the evaluations, but also PAHO's response to those evaluations. How are we taking all the recommendations on? How we are taking them on? What is our commitment towards implementing them? So we'll be publishing those. Look out for it. And we are enhancing our financial reporting. As Dr. Barbosa said, transferring somewhat of what was procedural, making that shift, transforming that in automated tasks so we can have more space for a better analysis and instruments for decision making. And the new chart of accounts that was implemented last year has allowed us and give us a good, solid basis to make that move. Finally, in terms of accountability, we are about to publish our new revamped accountability framework that aims at strengthening performance, harmonizing practice, and fostering trust. The accountability framework addresses personal responsibility entity's responsibility and the organizational's responsibility. We are working towards increased adherence to the procurement standards. Our procurement process is such that once the procurement made at country level reach a threshold, the threshold of the delegation of authority that I mentioned before, that procurement process needs to be sent to Washington, D.C. for another look. And right now, the return of those processes is at 37%. The procurement colleagues have developed a whole strategy on how to address that. They analyzed where are the recurrent issues on the lack of complete information, let's say, and the goal is to reach 20% of return by the end of PAHO Forward 3.0. In terms of increased compliance, we have determined that we're tackling 3 issues: compliance with fulfilling the performance planning and evaluation, or individual evaluation. The compliance until 2024 was 40% of staff fulfilled that personal performance assessment, and our goal is to reach 95%. I'm happy to report that now at the end of February, we have reached 96%. So let's hope to keep pushing for that. We have committed to also move the bar up in terms of completion of mandatory courses. That was at 70%, and we want that to go up to 95%. And regarding the telework agreements, we also put that as one of our indicators to be able to increase compliance to 95%. Thank you. You have received the full work plan with the framework, with details of the framework. So if you have any questions or if you would like to any clarification, I am at your disposal. Thank you very much. The mic will function as in the official session, okay? But we'll give you some time. Grenada, I recognize you, Minister.
Thank you. I just wish to commend the PAHO team on taking a clinical look at its operations and being able to drill down in the key areas and be able to present to us the changes that are going to be made and has already been made in some instances. And sorry, just want to encourage you to continue to evaluate and to improve, because if we fail to improve, then we fail to survive. So I just want to encourage you to keep on pressing on. And as an organization, I believe, and as stakeholders, we all would benefit from the advancement of PAHO and the improvement in its organization and management of resources. Thank you.
Brazil, you have the floor.
Obrigada. Thank you. I just wanted to echo the comments made by our colleague from Grenada and to say that it was very interesting to listen to the presentation and the progress achieved in areas such as integration of AI, which is generally a major challenge for organizations. This type of new technology is difficult to implement, and also you establish goals that are potentially achievable and that one can obtain results. And I think this truly helps to motivate people to try and improve even further. So I really want to congratulate you for the work, and we look forward to hearing about the outcomes and results of the third cycle. Thank you.
You have the floor.
Thank you very much. We're so grateful for presentation of this PAHO Forward initiative, as it leads us to improve efficiency and effectiveness of the administration through, in particular, looking at lower cost outsourcing. We think it's important to have key indicators and look at the performance for ongoing monitoring of these actions. And we look forward to hear about the future steps that you'll be taking. A while ago, you said that tomorrow we were going to be hearing about the Shared Services Initiative. Okay, fine. I'll wait till tomorrow with those questions. Thank you very much.
Muy bien. Muchísimas gracias a usted.
Thank you very much for those comments and for your support. And I think at this point, Dr. Barbosa would like to refer, because this is one of the programs that he suggested at the outset. Thank you, and thank you very much. This is a briefing session so that you are made aware about all the information available. I think it's important. This is a movement that, more than an initiative, it's a process to change the culture within the organization. We know that all organizations, whether public or private, have a trend to repeat the same processes over and over. And very often it's necessary to take a moment to review matters, seeking to check all the tools available in order to achieve greater efficiency, because member states require that every cent made available to the organization be used the best way possible. The limited resources of countries come from their citizens through the payment of their taxes. Therefore, it is an obligation for this organization to seek the best efficiency possible for those resources, and also to be highly transparent, especially in the organization's processes. What happens in all the administrative processes, in the budget, for instance, or human resource management, and all the facilitating functions within the organization, as well as technical cooperation. And also to show quite clearly that we feel responsible in all the actions we undertake. So I think it's an important thing to share with you. And I'm sure that tomorrow, whenever you want to make any other suggestions, or even at the executive committee, or share any innovative action carried out in your countries to modernize public administration, all of that will be valuable contributions. This could be a synergic collaboration to share experiences, and at the same time to share this desire to seek organizations that are more efficient, transparent, and accountable. So thank you very much.
We'll give the floor to our Deputy Director, Madam Melu Valdez. You have the floor for some announcements.
Thank you, Director. I'll be brief. We want, just to remind you, we invite you all, our delegates, for coffee and light refreshments right after this session. It will take place right in the delegates' lounge, which is as you go out. Hang a left when you get to A, and we look forward to seeing you there. Thank you.
Thank you. So the briefing session is concluded with this announcement. Thank you. See you in the coffee.